Good morning, everyone. Thank you so much for joining us. We are starting a little bit late this morning. Apologies. We did have some issues with the Zoom login. Our extra security features that we have in place have made it a little bit more difficult than usual. So we are about half of the folks who signed up are here, but I think given that we have a very full agenda, that we will maybe get started. So welcome. This is the official launch of the Social and Structural Vulnerabilities Program within the O'Brien Institute for Public Health. And my colleague, Megan Edwards, and I, and our partners at the O'Brien Institute are absolutely thrilled to be at this point in our work with this program of research. My name is Katrina Mullaney. I am an associate professor in community rehab and disability studies in the Cummings School of Medicine, and my colleague Megan is an instructor in that program as well. We have a packed agenda. The morning is really laid out to share with you what we have done so far in this work and getting to this point, and we have some great presentations. Dr. Elizabeth Day is joining us from Cornell University. She works within a program called Project 2Gen, which is a model that we are very excited about and have been looking at very closely in terms of how we might want to model our work here in Calgary. And we have a number of student presentations as well, students who have been working within this portfolio and with a lens particularly around COVID-19. So that will be our morning with a break. We also have Dr. Tom Stelfox from O'Brien Institute, and we are hoping that Elder Reg Crowshoe will join us. He's having some trouble logging in, so we hope to see him as well. The afternoon is our participatory approach to the day, where we hope to hear from our partners working in community agencies. We're going to facilitate some breakout rooms and some brainstorming sessions around big burning issues that we could potentially tackle with some good research, as well as some social action priorities. And the purpose of that is, if you are from University of Calgary, most welcome to join the afternoon sessions. Maybe an opportunity for you to hear from some of our community partners and maybe build some relationships. But really the purpose of that is to really hear from community, and your feedback will help guide our work in terms of identifying our priorities and our actions moving forward. So welcome. A couple of logistics. If we could move to the next slide, please. Thank you so much. So we do have 115 or so people registered. So we do ask that you leave your mic and your camera off to make sure that our internet connection is as strong as it can be. We will ask our speakers to turn your videos on when it's your turn to speak, so folks can see you. We are planning on recording this morning's session. We will probably create a YouTube video to post on YouTube, just to disseminate the information a little bit more widely. And then we will have an opportunity for questions. Sorry, I'm just reading a chat. Thank you so much, Liz. We'll have some opportunity for questions, and we ask you to use the chat box. So Natasha and Liz are here to help us moderate those questions as they come up throughout the day. So next slide, please. So I'd like to start by acknowledging that we are on the land of the traditional territories of the people of the Treaty 7 region in Southern Alberta, which includes the Blackfoot Confederacy, including the Siksika, Piikani, and Kainai First Nations, as well as Tsuut'ina First Nation and the Stoney Nakoda. And that includes Chiniki, Bearspaw, and Wesley First Nations. The city of Calgary is also home to Métis Nation of Alberta Region 3. I have personally had the privilege to sit with elders in my work, and some advice that an elder gave to me was, it's really important to do a land acknowledgement, but it means much more if you can say something personal about why being on this land is important to you. And so for me, I was born and raised in Calgary, and this place has been a place of safety and opportunity for me. I've done my education here. I make my living here. I've raised my family here. And I hope that my daughter will raise her family here. And so my Uncle Jim was Blackfoot, and his mom took him and his brother from their home community and brought them to Calgary many, many years ago to avoid residential schools. And he was a really influential person in my life. And he gave me some lessons, and the lessons were many, but the thing that he said to me that sticks is the most important way to be is gracious, and the most important thing to have is gratitude. And I think about him and that advice a lot, particularly in this past year when things have been turned upside down, and it's not always easy to be thankful and gracious. And so I am thankful, and I am very gracious that this land has been welcoming to me, and that I've been able to build a beautiful life here. So thank you for listening to that. And next slide, please. So just a reminder, we have sort of gone through this already, but our hope is that by the end of the morning, there will be a bit more clarity around what we're talking about when we're talking about social and structural vulnerabilities research, some of the findings from some of the research that is happening. And then again, this afternoon is really about hearing from our community partners and learning from our community partners in terms of guiding our work moving forward. Next slide, please. It is my pleasure to introduce Dr. Tom Stelfox. Dr. Stelfox is the Scientific Director of the O'Brien Institute for Public Health. And in his role, which is new in the last few months, I've had an opportunity to start to get to know Tom, and have been really inspired and excited by your leadership and the direction that we're moving with the O'Brien Institute. And so we're so thankful that you're here this morning, and I'll turn it over to you for a few words of welcome. Thank you.
Thank you, Dr. Mullaney, for that kind introduction. Good morning. My name is Tom Stelfox. As Director of the O'Brien Institute for Public Health, it gives me tremendous pleasure to welcome you to today's launch of the Social and Structural Vulnerabilities Program. The O'Brien Institute is a research institute at the University of Calgary. It's housed in the Cummings School of Medicine. It's got over 500 members of diverse experience and expertise that span the university, from faculties of arts, to science, to nursing, to social work, to kinesiology, to many others. It has members that are embedded or part of Alberta Health Services, Alberta Health, universities across the country, ranging from the University of Alberta to Dalhousie University. And it's got members who are part of non-governmental organizations that are so instrumental to our communities. The Institute functions really at the interface of the university and society. And its mission is research that impacts public health. Now, the O'Brien Institute for Public Health is committed to bringing scientists together with members of our communities to address the thorniest public health challenges. Social and structural vulnerabilities are one of those challenges. Many members of our institute have conducted highly successful research on vulnerable subpopulations. They've ranged from poverty to homelessness to immigrant communities and various other subpopulations in between. Dr. Mullaney and Dr. Edwards, national leaders in health inequities, bring us together today to build on that foundation of expertise and experience, and to focus our efforts on structural inequities. In preparation for today, I spent a few minutes reflecting on why today's work is important to me. And so I just ask that you indulge me with me briefly sharing this story with you. In many ways, I epitomize privilege. I'm a cis male, white, got university education. However, my privilege comes from ancestors who struggled through social and structural vulnerabilities. As a boy growing up in Edmonton, I can remember on many occasions my maternal grandmother telling me the story of how she came to this land. She remembers having dinner with her family in Eastern Europe in the 1940s, at Russian troops invading their village, that she and her younger brother, who were both teenagers and sort of the most agile, youngest, were able to escape out a back window and run into the forest, while the rest of her family was captured by the troops. They weren't soldiers, they were just simply members of society. The rest of the war was spent by her and her younger brother being homeless, trying to scratch out a living, whereas the rest of her family was in a work camp in Russia, where her older brother died. Her older sister and her parents were refugees after the war and went to a refugee camp in Uganda, and then came to this land here in Alberta, into Edmonton, as refugees. Through the efforts of the Red Cross, my grandmother and her family were reunited 10 years later, with my grandmother as a single mother coming to Edmonton with my mom. You know, she told me that, how grateful they were for that opportunity. And yet growing up in Alberta as an immigrant, not speaking English was not easy. Through hard work, the support of the immigrant community, and good fortune, they were then able to provide opportunities for the next generation that I'm so grateful for. This story is not unique. It's been told by thousands of Canadians. Many others have not been so fortunate. I share it with you because it reminds me of the importance of the work being proposed today. All of us will have our own experiences, whether personal or through interactions with members of our communities, that makes this meaningful and important. Today, you launch a program that will foster collaborations, build awareness, train future leaders, and create evidence-informed strategies to advance social change. I cannot think of a better place to be, and I cannot think of a better group of individuals to lead us in this work. Thank you for the opportunity to be part of this. I encourage you to lean in. And with that, I'll pass it back to Dr. Mullaney.
Thanks so much, Tom. That was a great way to get us started. Next slide, please. It is my honor and my pleasure to introduce Elder Reg Crowshoe. Elder Crowshoe is a prominent cultural and spiritual leader from Piikani First Nation in Southern Alberta, where he formerly served as chief. Elder Crowshoe has a long-standing relationship with the University of Calgary and has generously shared and offered his assistance, ceremonial leadership, and traditional knowledge to students. Elder Crowshoe is widely recognized for his dedication to Piikani artifacts, traditions, language, culture, and history. On a personal note, I've heard Elder Crowshoe speak many times, and your work on dual paradigms and ethical spaces has always been very inspirational to me. So thank you so much for being here. And Liz, if I could please ask you to assist with a virtual presentation of the ceremonial tobacco.
Hey, thank you.
Over to you, Elder Crowshoe.
Thank you. I'm just gonna light my smudge. In our, we're a verbal society. In our culture, we didn't have a writing, so we practiced following a oral system of practice. And in that oral system of practice, we use our sweetgrass to to start our gatherings, and kind of a call to order. In our belief, the sweetgrass is a sanctified kindness for all and a protection when we come together and start with our smudge. I'll call on my smudge. I just like to thank the O'Brien Institute and the leadership for inviting me to say the opening prayer this morning. I just want to acknowledge that in our culture, in our traditional ways, language and stories were a big part of our ways. And part of our creation story talks about how everything is created equal. The animals, the plants, the land, all human beings. And through that story is one of our natural laws, that we're all equal. And the sweetgrass is a sanctified kindness for all. So with that, I'll use the sweetgrass to open up your session. It's an honor to be able to open your session by acknowledging Creator. So I'll be speaking in my own language, which is Blackfoot. O Kishipatapi, Ionapi Natus, O Kitans Kachimadan Krishkadotani, Ayush Pumukinana Sutokyo, Akoshishkatu Pinana Nikamotani, Ioap Satokem Stikshi, Okkanoi, Ayush Pumusawan, Hanitschimakakyao, Nakamatu Samuk, so Nikotayak, Kuchi, Poispiawan, Christiakoik. Aokis pomosaus chipatapio, akoxis katopia kamutane, hanik nesta watsimane, hanik axipatapioxin, ais pomosaus chipatapio makita mokadoxao, anoxis kanotani, okini tama kamontan. I'd just like to thank you for the opportunity to start your day and your sessions with our smudge in our Indigenous traditional way. And I welcome everybody this morning, and I acknowledge the leadership for the O'Brien Institute and your workshops today. Thank you very much. I'll pass it back.
Thank you, Elder Crowshoe. On behalf of the O'Brien Institute for Public Health, I'd like to present you with this token of our appreciation. Thank you so much for being here with us. Liz, again, please assist. Thank you so much. Thanks, Liz.
Thank you.
I feel so privileged to start this day with such power and such peace. So it's always good to feel grounded and inspired, and you've certainly done that for me. So much thanks, Elder Crowshoe. Okay, so let us jump into our program. If we could bring the slides up again, please. And next slide, please. Thank you. Okay, so here is what we are here to talk about this morning, the Social and Structural Vulnerabilities portfolio or program of research within the O'Brien Institute, and a particular aspect of that portfolio, which is a research to social action hub. And the purpose really of all of that work is to formalize reciprocal and respectful relationships with our community partners and to prioritize community engaged systems change, particularly to support families, but really to speak about vulnerability more broadly. So Megan and I are going to guide you through the next hour or so. We'll probably speak for about 45 minutes and then we'll have some opportunity for questions. So I'm going to start us off. So if we could go to the next slide, please. So again, a little bit of background. What is structural vulnerability? There are some important distinctions in language which we think are really important to talk about. We're going to talk about our Community Rehab and Disability Studies program because the principles and the values that ground our, I'm going to call it SSV, the Social and Structural Vulnerabilities Portfolio. SSV is much easier to say, and we all love acronyms anyway. So our principles and values of the SSV portfolio really come from our orientation in CRDS. We're going to talk about community engagement and what it actually means in terms of the way that we hope to do this work. We're going to highlight the Research to Social Action Hub and how we got to this place. And Megan is going to talk about the role of students and undergraduate students and highlight some COVID-19 specific research related to the hub. Next slide, please. So how do we know we need to focus on social and structural vulnerabilities, or SSV? About a year and a half ago, we partnered, Megan and I partnered with Innovate Calgary to go through a community engagement process to help us understand what community needs in terms of areas of research focus and the role that the university could play. First of all, really to validate that this is an important thing for us to explore. And so we spent about a year in this consultation process, and we engaged with about just over 40 agencies, mostly in the city of Calgary, some provincial, with some guiding questions and some focus groups. And many of you that are here today participated. So I'm absolutely thrilled to be able to follow up with you and show you where your important contributions have led us. We also did an environmental scan. So we looked all over English speaking world, because that unfortunately is the language that we speak, and looking for other models and other hubs. We found quite a few, but we sort of landed on one that I've already mentioned, which is Project 2Gen. And thankfully, Dr. Elizabeth Day is here today, and she can talk about Project 2Gen, but it really was a model that sort of encapsulated what we thought would be a good model to implement here in Calgary. We couldn't find anything else in Canada quite like this. And we did have two students, Masters of Public Policy students here at the University of Calgary, who did their capstone projects with us as a follow-up to sort of pull on these threads of what is community engagement and what would community like to do with us, as well as Ash is here to talk about his project where he engaged members working in government and asked them questions around how would you like community to approach you? What would you like to see in terms of community engaged research, and do you have priorities? So Ash is going to share the findings there. We have done quite a bit of collaboration also internally here at the University of Calgary and have become members of the Alberta Children's Hospital Research Institute, the UC Knowledge Engagement Team, the UC Community Engagement Portfolio, and again, we've maintained that original partnership with Innovate Calgary. Next slide, please. So all of that consultation was really good fuel to help me grapple with some of the things that I've been thinking about in terms of vulnerability research. So my research program of research has its roots in community. I spent about 10 or 12 years in community agencies as a researcher before I came to U of C. And all of my research was in homelessness or poverty, domestic violence, mental health, addictions. So all of what you might think of as social determinants of health, or all of the ways in which people experience vulnerability. And all of that background research and all of the consultation that we did has really pushed us to move towards the language of structural vulnerabilities. And there are lots of ways to think about vulnerability, and a typical way is for us to think about vulnerable people and the ways in which people experience vulnerability because of their personal situations. So for example, so someone who is vulnerable has limited capacity to cope with diversity or adversity. And I like to use stories to highlight what I mean when I talk about some of these sort of theoretical constructs, because it makes sense and it makes it more real. And so I met a young man. Some of you have probably heard this story. I use Mike's story a lot to help illustrate what we're talking about. And when I met Mike, he was about 22. And he grew up in Calgary, and when he was a toddler, his family's story hit the newspapers here pretty widely, actually, because he was in a very abusive home, and both of his parents were abusive. And when it came to light that this was happening, Calgarians were outraged, and they wanted justice and they wanted something done. And so we sort of, when we look at those newspaper stories and when we hear Mike's story, we think about the ways in which he was vulnerable because he was in an abusive situation and because he was a child, he was being harmed. So that's a typical way of understanding vulnerability. Structural vulnerability, to me, is when forces outside of our control limit our opportunities. Things that we have no control over that have a big role in dictating our pathways and limiting our choices. And so I think of it, structural vulnerability is the ways in which people are made vulnerable or kept vulnerable because of the way our systems are organized, our policies are developed, the silos that exist between systems, the bureaucracy embedded within them, et cetera, et cetera. And so if we go back to Mike's story and we think about the structural vulnerabilities at play, when Mike was removed from his family, he went into the foster care system, which is a very good experience for a lot of young people. It didn't end up being a good experience for Mike, and he bounced around a lot and never really found a family where he felt safe or where he fit. And so as he moved through life, he never had an opportunity to deal with that trauma that he experienced as a toddler and that abuse. And so life got more and more difficult for him the older that he got. And when he was in school, he started acting up and got into trouble at school and was suspended and expelled. And then, of course, as is often the pathway for young people, ended up in the justice system. So when I met him, he was 22, as I said, and he was living in one of our homeless shelters. And he said to me, you know, Katrina, when I was a baby and these bad things were happening to me, Calgarians were outraged. And he said, when did they stop caring about me? When I turned 18, when I started using substances, my first night in shelter. He said, I don't understand. I don't understand when that shift happened. And so when I think about that story, I think about all of the intervention points along the way, whether it was the child welfare system, the school system, the justice system, any of those systems where he would have interacted. When he was acting out, he was actually reaching out, and he didn't get the support that he needed. So that's just an illustration of structural vulnerability, or the ways in which systems can actually, I'm not saying that this is intentional or that there is bad behavior or people are have bad intentions. We all come from this work with good intentions, but sometimes our systems just don't work. And Mike's story is an illustration of that. Next slide, please. So this is just as important to me. So why not call our portfolio or program of research vulnerable populations? This is language that resonates with people. It makes sense. When you say vulnerable populations or vulnerable groups, people kind of understand what you mean. And so I want to talk about that a little bit. There's three sort of big reasons why I would like to shift away from that language. On the one hand, when we say we're going to focus on vulnerable populations, that means we have to identify what that means. And that means we have to choose who is vulnerable. And when we take that approach, it can actually be quite exclusionary if a particular group is not specifically named. And I've had that experience in my work previously. When our focus was on certain groups or certain people, it means certain groups and certain people get left out. Another reason, which is important to me and my values, is that when we come out and say a particular group of people is vulnerable, like people with disabilities or newcomers or Indigenous people, it actually is quite disrespectful to people who may identify as members of that group who are not vulnerable. Who are strong leaders and who are mentors and who are making their way in the world. And so by using that umbrella term that this group of people are vulnerable, it negates the positivity and the power that can be there, which I think is very, very important to acknowledge. And of course, the last reason is what links us to the program of research itself, which is if our language is around vulnerable populations, we can actually be reinforcing stereotypes as well as becoming preoccupied with people and people's problems and what's wrong with people, rather than the structural barriers or the policies and systems that are in play that are having an impact on people's experiences and in some cases causing harm. So for me, social vulnerability or experiences of vulnerability like poverty, homelessness, domestic violence are actually a way in to help us understand where the problems are at the structural level. Next slide, please. So what do we hope to do with the Ssv program? The overarching statement that grounds us is our role is to examine and attempt to disrupt social inequities or structural inequities that exacerbate social vulnerabilities. So all the things I've just said. And so our vision at the point we're at now is to become a national leader in social issues and social and structural vulnerabilities research. And I think most importantly for me, and the way that I see that this work could be sustained and set apart from other work, is to put some really concerted and intentional efforts into translating research into some kind of change. And we're going to talk about that a little bit more. Next slide, please. Are we able to advance to the next slide? Thank you so much. So we have some big goals for the next couple of years in particular. This is our official launch today, so we're thrilled to be at this point. But we have some goals that we're focusing on for the next 2 years to sort of build the infrastructure and our priorities and our partnerships. And so we hope to start to fill the gap between community and government through collective and respectful advocacy and government relations. And so a big part of social change, obviously, is having good partnerships with the people who make decisions. And so we hope to prioritize government relations as a part of this portfolio. We have a plan in place to take a look at what's out there now. We've done a preliminary scan around structural vulnerabilities. It is an emergent area of practice. And so we've put in for a small grant, or we're going to be putting in for a small grant to do a knowledge synthesis project. So that will help us understand who's talking about vulnerability, how they're talking about it, what kind of research has been done in this space, and where we could potentially fill some gaps. Next slide, please. We also need to identify gaps in our work with community and to figure out where we might not be working right now. So I can only speak to the O'Brien Institute, and there's lots of great research happening that I'll highlight a little bit later. But I don't think from my very cursory scan that, for example, there's a lot of work happening in domestic violence in our faculty. Or if there is, and then how can we elevate that? How can we highlight it to give it a bigger profile? So how can we fill some gaps? We do, like I said, want all those partnerships that I've sort of mentioned already as within the university. We definitely want to strengthen those partnerships. Community engagement is a part of the University of Calgary's strategic priorities. And so there are pockets of people working in this area. And so we've also put in for a grant to do a social network analysis, which is a visual mapping exercise to show who in our university is working with who in community and in what capacity. So we can see how many agencies we're working with, which agencies, and who we're not working with, and whether we could use that information to formalize some partnerships. So this is really meant to help strengthen the university's priority and portfolio towards community engagement. Next slide, please. So what that means is our priorities are around systems level community engaged research. And like I said, how can we understand the experiences of people to shine a light on where structural inequities are creating vulnerabilities? And the collective action piece is particularly important in partnership with community to try and unpack and influence flaws in our policy, build our government relations, look at innovative new programs, for example, that could work to bridge some of these silos and some of these gaps that we all know happen in our community. And next slide, please. So I'm going to turn this over to my colleague, Megan, who's going to talk a little bit about our CRDS program and how this is really our grounding in this work. So over to you, Megan.
Thank you, Katrina. And good morning, everyone. Thanks for coming today. We're so happy to see all these participants and everyone who's interested in this particular perspective. And as Katrina said, this grounding. I think it's really important to sort of reiterate what Katrina already said around the concept of being made vulnerable, or the systemic and structural vulnerability. Because CRDS, or Community Rehab and Disability Rehabilitation and Disability Studies, that's really our grounding as well. It's looking at systemic and structural factors rather than looking at individual deficits or individual problems, but really looking at how we can be sure to look at those vulnerabilities and try to mitigate them so that we're not focusing on the fault of one individual within a system that's flawed. So CRDS, as we call ourselves, is located within Community Health Sciences at the Cummings School of Medicine. And we've been at the U of C since 1979. So we're a very old program, really. And with a long history, we've been established in the community for a long time. Our students have very high satisfaction ratings and also high employment after they graduate. We have 375 undergrad and graduate students. So we're not a small program, but we are unique, I think, within that world. So here's some of the things that we look at. Our student knowledge and skills include the ability to look at how abilities have been labeled and how people are disabled by some of those labels, structures, and systems. We look at professional practice realms as well. So our students are not just existing from a theoretical perspective or a critical perspective, but they're taking those very important frameworks and bringing them into the real world, because our students go on to be leaders in NGOs, leaders in the community, members of government, looking at all different levels of marginalization and breaking down and disrupting disabling structures. So we also look at community development. We look a great deal at community development and how we can break down some of these structures that Katrina was referring to earlier. We do advocacy and we work with advocates in the community, and we look at systems and social policy. So specifically, those are some of the areas that I teach in our undergraduate program. And as Katrina mentioned, I'm an instructor. So while I do have a program of research, and this is a big part of it, a lot of my work will revolve around teaching and pedagogical approaches to disabling and dismantling some of those structures. So we also look at program design, development, management, and evaluation. So our students are armed to go out there and change the world. Next slide, please. So community engaged learning. It's a broad umbrella term that's being interpreted in lots of different ways. It's having a moment right now, or it certainly was, and I think still is, but then COVID came along and sort of we're all pivoting like crazy. But definitely community engaged learning is very important across the U of C and really across Western academia at the moment. I think what's important about CRDS and also the grounding of community engaged learning within the Research to Social Action Hub is that it exists at the intersection of theory and critical engagement and community advocacy and community work. So we're asking our students and those who work with us to go out in the community with a critical eye to the systems and structures that exist, such as siloing and policies that are ineffective or inequitable, but to also be learning how to work within those systems, learning how those systems work, learning how things go in the community, and working with community partners and people on the ground. So it's a very interesting place of tension oftentimes for our students, but we really, as Dr. Stelfox mentioned earlier, we lean into that place of discomfort and we look to disrupt some of those ideas and really start to move towards justice. So when we think about community engaged learning, we're thinking about the co-creation, implementation, and dissemination of programs of research that really elevate the understandings of people with diverse abilities and the disablements that they face. So we're looking at enhancing policies and practices surrounding people with diverse abilities or those who have been disabled by systemic structures. So we're looking at the establishment and maintenance of community service, learning and practica, and the research partnerships with community organizations. So our students do a lot of hours of community work. So they're out in the field, they're working on these practicum placements. They start in their first year, they go on to in their third year, and by the time they're in their senior year, they're leading projects in the community with our partners. It's very meaningful work, it's very important work, and it's a big part of the learning of our students and what we like to say is the transformative learning. So really shifting and changing the way that they look at the world. We very much prioritize the establishment and the maintenance of partnerships, and we really do that across Canada and across the world, working with other faculties and disability studies at different universities. So it's very important for us to work in partnership in that way. Okay. Can I go to the next slide, please? I keep forgetting I can't do it on my own. So our program's recognized as a leader in the field, and it has a lot of strengths. Like the first one is our strong connections with the community, as you can see today. It was a natural fit for Katrina and I to start thinking about some of this work, the work our students do in the community, the work that we do as academics in the community, and how we can ensure some of that reciprocal equitable partnerships are formalized in such a way that we can have an impact on policy and start to break down and disrupt some of the systemic and structural ways that vulnerability is created and perpetuated. And we have over 150 community partners in Calgary from a wide range of community organizations. And it's really important to us to keep those relationships strong, and we work together very closely. So we have lots of different types of modalities. We have an emphasis on peer mentoring. So mentoring is a huge part of our program as well. We're anchored in empowerment and interdisciplinary collaboration. So you'll hear a little bit more very shortly about some of that interdisciplinary work when we have some of our students presenting their work. We have investment in social policies that impact people. We're looking at social change. And importantly, buried in this bullet list is framing of disability as a social, cultural, economic, and political phenomenon rather than a deficit that's located within the individual. Our students, as I mentioned earlier, in their practica do a work-study model, and we have very high student satisfaction ratings. Okay, Liz, can I go to the next one, please? Okay, Katrina, I can't remember if this is me, so I'm sorry. This is me, yeah?
I think it's me.
Oh, okay, great. Sorry.
Thanks. Yeah, so hopefully, you start to see a line of sight between our sort of community engaged approach to research that we're prioritizing and some of the principles and values that are grounded in our CRDS program, because it really gives us a strong foundation to know how to do this work. So a really important part of the SSV portfolio is what we're calling a Research to Social Action Hub. And this hub came from the conversations that we had with our 43 agencies over that kind of 12-month period. And the hub itself is meant to provide the infrastructure and a vehicle to start to translate really good evidence-based research into practice changes, into policy changes, in partnership with researchers in academia, researchers in community, government, as I've already mentioned, community-based service agencies, really in a respectful and reciprocal relationship way. And so, again, our interest is elevating the issues from the community level. Innovation doesn't happen at the University of Calgary. I shouldn't say that. Lots of people are working innovatively at the University of Calgary, but when it comes to social issues and social change, the innovation opportunities, I think, are in community, where people are working frontline all day, every day, with social issues in a way that is not academic or theoretical, that is real life. And so community agencies and people who work in agencies and people with lived experience know what the problems are, and they often know what the solutions are. And so the hub is meant to start to move forward on some of the big issues that we grapple with, and some of the sort of consistent and structural barriers that make providing meaningful care to people quite difficult sometimes. And so we are in the process of developing a network of service providers. We followed up with our agency partners after our consultation process with a quick survey to say, how do you want to be involved? Do you want to be part of the governance structure in terms of being a member of the advisory committee? Do you want to be a partner where we can broker relationships between your agency and researchers who may be able to provide some research assistance? Do you just want to be kept in the loop? And so we've got a sort of preliminary list of people who are interested, and we will follow up after this event with those questions as well, if others who now know a little bit more about the portfolio want to play a role. And so really the purpose is action. We all know this really came from my work in community, where I was approached many, many times by academics saying, can you help us with this research project? We'll put you on as partner on a grant, help us recruit participants. And of course, we were very happy to do that. But often what happened in my experience was we never heard from them again. They would go on to publish or present at conferences. And sometimes we were included, but lots of times we weren't as community agencies. And I struggled with that a little bit because it didn't seem reciprocal to me. And so the purpose of this hub is to really be much more intentional in those partnerships and to do the work in a way that is meaningful to community partners. Next slide, please. Oh, right. So I just wanted to highlight that process that we went through to develop the hub itself. I've already talked about this a little bit. This is sort of the timeline. And we had a couple of interns from Innovate Calgary who helped us through this, and they actually created a one-page model that we're using as a platform for what the hub could look like. And so just to reiterate, so when we did that environmental scan of hubs and initiatives across Western world, I guess, we found 19 hubs that we wanted to follow up with. And so we did those individual interviews. That's how we met Dr. Elizabeth Day. We did focus groups with the agencies as well as a number of social work students here at the University of Calgary. Next slide. And here's what we heard. So this is what community told us around operationalizing this model or this hub. To be very clear about defining our key concepts. What do you mean by vulnerability? What do you mean by families? Who are you going to be supporting? How are you going to do it? Very clear message that there's lots of great work already happening in community, and that our role is to avoid duplication and leverage that great work in the terms of partnerships rather than trying to reinvent the wheel or do things that already have some good sort of momentum happening behind them. And again, we can't be everything for all. And so we did land on families, recognizing that families are all kinds of things and mean many different things to many different people. And so we felt if we focus on families, that gives us an opportunity to talk about things like prevention when there are children in the household and strategies to prevent the sort of cycling of the ways in which people experience vulnerability as they move through the lifespan. Also recognizing that if there were policies or programs that could be implemented or developed that would be relevant for families, they would be relevant for all kinds of people. So, so that's where we've landed so far in terms of being able to have an area of focus, but still being able to be flexible and adaptable to what the issues are. Next slide, please. So community was also, we were very happy to hear, many community agencies are interested in research partnerships. And there are some agencies who have said, this isn't for us, that we don't see ourselves here. We have capacity to do good research and we have good relationships with researchers already. And so that's great. And so, the research partnerships came from people working in agencies who see the value in that and who would like to be engaged in more research, but maybe aren't funded to do it, maybe don't have the capacity or the time because they're very busy in service delivery. And so what they told us about research partnerships was again about equity and reciprocity, and that it really does need to be a true back and forth, and not like the example that I shared where you pop in and you collect and then off you go, never to be seen or heard from again. And part of that in my work at least has been, how can we translate this research into some recommendations or some action items that then community agencies or collaboratives that already exist can strategize about how to move forward with collectively. So that's just one example. There was lots of suggestions around leveraging the resources we have at the university, which includes the things that Megan was talking about around Practicum and students and how they can play an important role in bridging the gap between research and practice. And again, to be very clear that this is not a University of Calgary initiative, that if we are truly engaged in community scholarship, that we need to prioritize community interests and community needs. Next slide, please. And the other big point that came out from some of the agency folks that we talked to is there's some good data being collected already. So what can we learn from the data that's already out there? Many agencies, like I said, are using data that they collect for research purposes, and many are using them to report back to funders and to fulfill the obligations of their funding contracts. which can leave a gap if there's really great data there that could be utilized for informed decision-making on the sort of broader systems level, but we maybe don't have the capacity to do all the time. And some of the other ideas that came forward from some of the smaller agencies were, are there agencies who have really good intake tools, who have good evaluation frameworks, who have good databases, rigorous approaches that they could share with us? And so can we through the hub be brokers for some of those relationships to help facilitate some data sharing? And ultimately, wouldn't it be amazing? This is a very pie high in the sky idea, but if sort of every program that was working in sort of domestic violence prevention, just as an example, used the same intake and shared that data across the system, what could we learn from that? So some really good ideas about how to leverage, understand what's being collected already, and use that data in really proactive and productive ways. Next slide, please. And of course, this is the issue that comes up a lot. So it's all well and fine that you get your grants, Katrina, and you do your research and you publish your papers and do a presentation at a conference, but what does it change? It doesn't change anything, at least not for people not in academia. And so how can we really prioritize the translation of research into some kind of social change? And the ideas that came out from community were around influencing public policy, being really intentional in our language around lobbying. Advocacy has a historical, historically has been kind of a bad word in a lot of sectors. There were actually limitations on agencies in terms of the amount of advocacy they were allowed to do. Those restrictions have been lifted, but advocacy is actually something that requires particular skill sets and a lot of time. And so is there a way that the hub could play a role there in terms of taking some of the recommendations from community and building advocacy plans, building government relations plans, drafting policy briefs, working with collectives and collaboratives that are already in place to move things forward with a collective voice, which we think is really important. And Ash will tell you what government said about how they like to be approached by communities. So being mindful of that as well. And there are a number of amazing collaboratives already working in our city in the homelessness sector, in the domestic violence sector, in mental health and addictions, multiple agencies with common interests who are already mobilized, already have infrastructure in place to be that collective voice. And how can we leverage those resources and those initiatives and align with their priorities and support their priorities with this kind of translation into change? Next slide, please. So we did have a platform, a one-page model that is created that includes some value statements, that includes key activities, stakeholders, the resources that we would need, et cetera. We've chunked it out in these next few slides and just sort of reinforced it with some quotes from our consultation process from community. And so, you know, this is just to highlight, you know, what people said, that resources should be enabled for timely, strategic, ethical.
Katrina, we can't hear you, sorry.
Katrina, we're just having a bit of trouble with the audio. Megan, are you able to jump in here?
Sure am. Yep, no problem. And Katrina, if you can hear me, as soon as you're able, you can just interrupt me. Yeah, so as Katrina said, this is our sort of one-page model campus that we came up with in collaboration with, I'll start my video. In collaboration with our student interns that we worked with last summer. Next slide, please. and looking at who our key partners would be. We will have a community. This is the governance piece, which Katrina will speak to more later on in the day. But looking at some of our key partners, we'd want to have a family advisory council. It's important for us to have partners with government at all levels, multidisciplinary researchers. As we mentioned, we have Dr. Elizabeth Day here with us today from Cornell, and she's going to talk to us about a similar model that they have there, Project 2Gen, and of course, donors and funders.
I'm back. Can you hear me?
Yes.
Sorry about that, everyone. I guess that's just the way it goes sometimes when we need technology to guide us through the world. So thank you for letting me know. I did get kicked out there for a minute. So thank you, Megan, for stepping in. We did plan for this scenario, so we are here to support each other if that happens again. And so just again, just a few more quotes. I feel like I might be freezing again, but anyway. So could we maybe move to the next slide, and we'll just show you a few more illustrations of what our partners told us. Yeah, so in terms of activities, a real priority placed on better collaboration and opportunities for partnership. This came up over and over again. And for academic research to really have a greater focus on community priorities. And so I think we've already talked about that quite a bit. But also thinking about the hub as a place for brokering or relationship building. So if an organization was looking to do some research in homelessness, is there a role that the hub could play in connecting them to a researcher who has an interest in working in this space, who then they could go after some research grant money and work together towards that goal. Next slide, please. And so again, in terms of buy-in and support, we heard lots and lots, as you can imagine, about funders. And this is one thing that I'm very mindful of. I think when we're talking about something that is really grounded in change, we're not talking about indicators and metrics. We're talking about outcomes. And outcomes are a lot harder to measure and show, and they take time. And so there's going to be some work, I think, as we continue to look for resources to sustain this hub, to start to push funders toward that idea of outcomes as being far more important than how many papers did you publish, how many events did you host, how many people showed up at your events. We honestly, we have to do that anyway, and it's important to collect those kinds of metrics. But really, the work I think that we're going to have in front of us is how do we prove the value of work like this in terms of influencing outcomes. And in our case, we're talking about outcomes for families or people who are experiencing vulnerability in some way, shape, or form. And so I think it was we also heard some critical feedback, which was that we get asked to contribute to the development of policy frameworks, policy documents, research projects, and our input is often not represented in that policy. And so how can we, again, balance diverse perspectives and viewpoints, which is important when you're developing meaningful action, that it is grounded in diverse viewpoints. And so can we, again, within the hub itself, play a role in brokering that kind of piece? And then just reiterating again that collecting data, using data, translating it requires particular skill sets. And so for us, we need to think about what type of staff should we be hiring in this hub. We have limitless research capacity at the University of Calgary, and in community, really, there are lots of people doing research in lots of areas. So is that what we need, or do we need to just broker those relationships and bring people in who can lead that research? And then we would prioritize people with government relations skills, people with advocacy skills, people with writing skills who could help design a new program or build a plan to engage government in solution-focused kind of thinking. So helping us to think about what is new and different about this and how we can value add by adding very basically skills and capacity in ways that are really targeted at translating research into action. Next slide, please. And so who benefits? You know, I think at the bottom line here is that what we're talking about is families and people and children. And so we need to ground our work specifically in that always. And our decisions need to be guided by what is best for people. And so one of the things that we're hoping to build into our governance structure, in addition to a community advisory committee, are family advisors, elders, who we would be reliant on for their expertise and their guidance, particularly around solutions. If you ask someone who is living in poverty what they need for things to be better, they know what they need. And our job would be then to elevate that voice and to figure out how we can mobilize some action around that. Next slide, please. So I just want to highlight a couple of projects to kind of make this real. And I have a number of projects happening right now that I'll just skim over very quickly. We are currently working with the Aboriginal Standing Committee on Housing and Homelessness and Alpha House and the Drop-In Center on a managed alcohol program for Indigenous who are or have experienced homelessness. And managed alcohol is a harm reduction housing program meant to support people to access alcohol at particular intervals during the day. These are people with severe substance dependency, often people who are using substances not meant for consumption. And so the idea is to have nursing staff on site to provide administered doses of alcohol and to ensure that people have access to the healthcare and the supports that they need while in housing. There's a cultural component that is deeply embedded. We have a circle of elders who are advising us, and we are making connections between participants in the program to elders to support the cultural and the spiritual healing needs that if people choose that. So that's a 3-year project. We are evaluating the impact of that and looking to see what difference it makes in people's health and well-being to have access to safe and supportive housing and good care. Another one really quickly that I'm really excited about, this is just getting started. We are working with 5 youth homeless shelters across the country who have implemented what's called diversion. And so these programs, instead of just taking youth in and saying, come into our shelter, they spend a lot of time and energy on family reunification and with the family to see if there is a safe place for the youth to return home, for the young person to be in a home, even if it's not immediate family, anyone in the family, and working with that family to help them stay together. What we know about youth, once they get into homelessness, they are highly vulnerable to violence and victimization, and at very high risk for chronic homelessness into adulthood. And so these shelters are showing very promising early results around homelessness prevention, which is just a cycle and an ongoing pathway out that is beneficial in so many ways. And so again, we have 3 years, and we're going to engage with lots of youth and their families and look at the data across these shelters and see if we are actually preventing youth from homelessness or just delaying it. So we're going to be able to track whether they come back into homelessness. And we're going to use all of that information to design a model that can be translated to cities all across Canada who want to start investing in shelter diversion as a form of homelessness prevention. So that one's pretty exciting. I have been supporting, again, another project with the Aboriginal Standing Committee for Housing and Homelessness and the Indigenous Health, Housing and Homelessness Collaborative through the National Housing Strategy, which is really taking stock of what is happening in our city, in particular around safe, affordable, culturally appropriate housing for Indigenous people. And so we're figuring out what the capacity is right now and strategies to help build capacity for housing that is specific, housing and programming that is specifically designed for Indigenous Calgarians. About 5 years ago now, we did a study with the homeless shelters. We engaged 300 people in chronic homelessness to assess their length of time in homelessness, their patterns, their health needs, their substance use patterns, their mental health issues, and their experiences accessing services and supports, whether it's housing or treatment programs. We also used the Adverse Childhood Experiences Survey, which assesses levels of childhood trauma. We are redoing that study this year. So 5 years later, we're going to assess if anything has changed. There's been some amazing work happening in our city around rapid rehousing, prioritizing housing for people in shelter. And we hope to be able to show the impact of some of that great work with this follow-up study. We are doing a study with the City of Calgary on mask use and who's wearing masks, who's not wearing masks, why aren't they wearing masks, what are some of the behaviors driving those decisions, and how we can use that information to influence public awareness campaigns through the City of Calgary, targeted conversations with particular groups of people. And also very briefly, we are doing a study around low income and COVID-19. And so a broad survey, which is on the university's page, if you have an interest in participating, asking people how COVID-19 has impacted their lives, particularly people in low income. So how has it affected your access to basic needs, your ability to work, your health, your mental health, your families? And so the common thread in all of these studies, again, there's some aspect of vulnerability, but it's really how can we use the results of these studies to change the way we do things now. So those are just highlights of a few projects that I'm leading. There are many, many members in the O'Brien Institute who are working in this area. There's a study happening right now around COVID-19 and Cargill, the biggest outbreak in Canada. There's researchers working in refugee health, Indigenous health and housing, reducing barriers to healthcare, mobile healthcare, community-based healthcare for people in homelessness and at risk of homelessness, low income and food security. There's tons of great work happening in harm reduction as well. And so our goal is to start to reach out to these folks and ask, do you want to be a part of this portfolio? And if you do, how can we support your amazing work, build capacity, build a collective voice within the O'Brien Institute, but ultimately the University of Calgary, and then ultimately at the national level. And so we think the project that I talked about, the social network analysis, will be a great start to that, because it will help us identify who in our communities are working together and how we can reach out to those folks and see if we can work together in a strategic and intentional way. Next slide, please. So I think I'm turning it over to Megan here, and she's going to talk a little bit more about some COVID-19 work that's happening.
Thanks, Katrina. As Katrina mentioned, a lot of our research is looking for ways in which we can impact policy and the responses that we have to different issues as they come up. And the perfect example of that is our COVID-19 response. COVID-19, like nothing else, has really highlighted the inequities that already exist. And there's certainly been a great need for research around our response to the pandemic and the impact of the pandemic around marginalized people. One way in which the Hub has been in action is I've been working with a provincial task force, soon to be known as the Alberta Ability Network. It's an initiative of the Cerebral Palsy Association, and it's a part of the Calgary Ability Network, looking at re-entry strategies for when some of these pandemic restrictions begin to ease, and what that looks like for the disability sector, from children to adults to families, including this task force communicates with and includes provincial and municipal government representatives, HS, agencies, self-advocates, organizations, families. We've done a great deal of work with this task force. I believe it was convened in April or May of last year, and we've been very busy. I think that it's going to be most interesting for you if you hear all about some of that work from our students. Katrina alluded to Ash's work. Ash Seth has been working, he did his capstone on how government would like to hear from community on some of these issues around COVID-19 and responses to such. Jessica Kohak, who I'm going to be presenting her work because unfortunately she couldn't be here today. She looked at some of the ways in which community agencies serving families might like to interact with government around influencing some of the response to COVID-19. And Candace Parsons will speak. She's a current Masters of Public Policy student, and she's going to talk to us about what we're up to now, looking at surveys and trying to find out how that response looks for individuals and families. So that was a huge part of our work over the summer and the fall. We really developed a set of resources that have been extremely useful. I'll go over some of those in a little more detail in a bit. We also had a set of policy recommendations that we've been publishing and communicating. And it's been a natural fit for us as CRDS faculty and those who are working within the Research at Social Action Hub to work with the School of Public Policy in that cross-disciplinary space, because we're both interested in policy and how it impacts people. And so I've been working in partnership with Dr. Jennifer Zwicker at the School of Public Policy, and we've been co-supervising these 3 students I was speaking about. And the students really showed their ability to pivot, as we're supposed to say, because originally the idea was nothing to do with COVID-19. It was just around shaping policy, and they've done a really fantastic job. So looking forward to sharing that with you. Can I go to the next slide, please? Yeah, we also have our practicum students that I mentioned before, our undergraduate practicum students working in the community, doing work specifically with the task force I just mentioned, but they've also been doing other types of work, really working on how to deliver services and ways in which we can reach out to the community even during times of isolation and restrictions. So currently I'm conducting a study, almost finished the data collection stage, on transformative community engaged learning. So looking at how we can be in reciprocal and equitable relationships with our community and impact policy at the same time as having that critical lens and looking at systems and structures and disrupting systems of oppression within our society. So it's a very sort of, like I mentioned earlier, it's a very interesting space of tension. And so I have practicum students working on that project with me and student research assistants. So this is going to form the beginning of the Hub's protocols on how students will be in the community and how we can respond, most importantly, to community needs and keep those voices at the front. Okay, next. I shall hand it over to Katrina for this next step.
Yeah, so we just want to wrap this up to let you know what we're planning for our next steps. We do have some partial funding for the next 3 years to support a research associate, which Natasha, who you may have heard from through email and maybe saw this morning. And so Natasha joined us in September, and she has a phenomenal background in community engagement and excellent skills, which we are just so thrilled to have. So we have Natasha with us to support this work. She has other work in her portfolio, but this is part of her portfolio. My plan this year is to recruit a postdoc. This is something that we learned from our friends at Project 2Gen, who we would be able to have for 2 years to guide, again, some of the high-level research priorities. We are working very hard to formalize the governance within the Hub itself. And so I did mention that we have a bit of a quick survey that we will send out, just inviting people to identify whether they'd like to participate or not, and in what capacity. So we are working through that. And like I said, we do envision multiple governance layers, including community advisors, as well as families and individuals and elders. And hopefully we will get these 2 grants that we have out, looking at the social network analysis and the knowledge synthesis around vulnerability research and what it means and who's doing it and where the gaps are. And all of that will be supplemented by what we hear this afternoon from our community partners, and that will help us mobilize our priorities for the next few months in terms of starting to move away from launch and away from rhetoric into some good research and some good actions. So that's our plan. Next slide thing. I think that is it for our piece. Yes, so please feel free to reach out to us at any time if you have questions. You will hear from us after today. We will submit a report back to all of the participants who registered that will highlight this afternoon's work for those of you who aren't able to join us. This session, this whole morning actually will be YouTube. So we will send that link out when we send out the report back. But do obviously in the meantime, reach out to either Megan or myself if you have any further questions. I'm going to stop there. I think our last slide is about questions. We said we would be done this portion by 10:20 and it's 10:19. So that's not too bad, I don't think, since we got a bit of a late start. But I would like to ask Natasha to help us moderate some questions in the chat. I know that a couple of questions have come in. If you have questions, please put them in the chat and we will do our best to answer them just over the next 5 minutes or so. And then we'll move on to the next part of the agenda.
Thanks, Katrina. Thanks, Megan. So one of the questions that we had came in from Ashley, who is wondering how you see evaluation and in particular community program evaluation fitting into being a part of in contributing to the Research to Social Action Hub.
Mm-hmm. You know, community partners did mention that as a priority. A lot of agencies are doing evaluation work. The challenge that I find with evaluation researchers is not always accessible. So an organization might do some evaluation of the impact of their program, and sometimes they're able to share it and sometimes they keep it internally. And I think there's just amazing learnings in that kind of evaluative research that I would love to make more accessible. And so I think if an agency came to us and said, you know, we want to do some evaluative research, or we want to highlight our research, we could potentially be a broker to share that information, maybe translate it into some plain language reports, host some seminars or webinars, et cetera. So I see it being an important part of the hub if it is brought forward from an agency or agencies.
Sure, and it could potentially be an example of multi-year practicum placements as well.
Mm-hmm.
So we could have some of our students who've been trained in research methods and some evaluation methods to work and hand off the project over several years.
Mm-hmm.
Yeah.
Fantastic. Another question that came in from Zaman Ara and Rachel Edwards. We're wondering how, as community members, and I know you've touched on this, but if you could elaborate a little further, folks working in harm reduction, disability, working with seniors in the homelessness sector, how can those folks get involved with the Ssv program and potentially move towards developing research projects together?
Mm-hmm. Yeah, it's a great question. These are all the things that we're sorting out in terms of the logistics, but the first step would be when we send out the follow-up survey, we have created some categories of partnership, including governance, research partnerships, or sort of communications and keep me in the loop. And so we're asking people who are interested in participating to let us know how they would like to be interested. And then we will follow up you know, in the appropriate way based on how people self-identify. So we would envision our advisory committee being engaged regularly in our decision-making. We would anticipate people in community or research or agencies interested in research projects or participating in advocacy or the collective action aspects to have an avenue in by identifying that as their interest in partnership. And then we probably will have regular communications like newsletters or events that we're working on, webinars that we would circulate to people who just kind of want to be kept in the loop. So keep an eye out for that survey. It will come with the report back. Yeah, and so we'll look forward to hearing from people and we will follow up with them based on how they choose to participate.
Fantastic. So we did have another question from Ellen Charge, wondering, a two-part question. First, if you could comment a little more about the word vulnerability and vulnerabilities. You touched on this in the beginning of your presentation. Ellen was wondering if you could comment on how we use this word in theoretical areas has implications for practice, and populations that they're working with can get quite offended by this word, even if we're using it to describe social and structural pieces rather than people themselves. And the second part of that question related to street cred, wondering how street cred is involved in the Ssv program.
Well, I'll start with the street cred question because that's the easier of the two questions. We actually, street cred is completely embedded in this portfolio. I didn't mention it in my slide, but in fact, we had a meeting yesterday to figure out how street cred could be part of the community advisory committee. When I mentioned the other projects that were happening, I didn't name specific projects because I didn't have people's permission to do so. But street cred is an initiative, one of the initiatives that's involved in community level and community-based healthcare and reducing barriers for people in homelessness or at risk of homelessness who need access to healthcare and other supports. And street cred has been instrumental in being an advocate, a mobilizer. Pursuing innovative ways to practice in the community. And so they are definitely a key part of the Ssv portfolio, and still working out exactly what that looks like. But yes, they are completely embedded and will be embedded in the decision making towards what Ssv will focus on. Now, the second part of your question is a little bit trickier, and language is something that we grapple with all the time. And we have to be very mindful of. And I do recognize that vulnerability is a powerful word, and it invokes all kinds of feelings in all kinds of people. And so I don't have a really good answer for why we keep the word vulnerability, except that we are prioritizing a different way of understanding vulnerability, that it isn't the fault of people. And the focus should not be on how we fix people, but on how we need to elevate our work and elevate our inquiry towards the structural barriers that, in my opinion, sometimes cause more harm than good, and in that way can be traumatizing and re-traumatizing. And so I don't have a good answer for you on why what other word we could use besides vulnerability, except that I think it needs to be kept at the forefront. But hopefully this gives us an opportunity to start to challenge the way people understand it and create some language about what we actually think it means, which isn't about blame or weakness in people, but in structures and systems that are not working for people.
Fantastic. And the last question that we have time for before we go to our next speaker comes from Jennifer Jackson. Could you comment on working in the current political climate and how to move programs like harm reduction forward despite having robust collaboration in place, how to overcome the current political challenges in our province?
Well, I know where this question is coming from because I know you. And I know that the amazing work that you've done around supervised consumption and harm reduction, and you guys, you're asking very hard questions. I've been working in government relations for a really long time, and there was a time in my history, at least, when I could frame a social problem using language that would resonate with decision makers. And one of the ways we did that, and I think we still try to do that, is using language like cost effectiveness, right? So if we can show an argument, if we can figure out a way to message what we want in a way that means something to decision makers, that gives us a leg in, typically. Now, Jennifer, I know that you have done some work in cost analysis, made very logical arguments for why we should be investing in harm reduction programs as a way to reduce costs and reduce system strain and all of those things that we talk about a lot. It doesn't always work. It doesn't always get heard. And so to me, again, it's just that it's coming forward with evidence as best we can. It's coming forward collectively, multiple agencies with a common interest. If we could agree on this is our problem statement and come forward with proactive solutions, you know, that could be helpful as opposed to one-off agencies going forward asking, you know, I think that sometimes doesn't always work. And so sometimes it works and sometimes it doesn't. I could give you 15 examples of where we've tried to move forward with action that went nowhere, and maybe 2 or 3 where we had some good outcomes. And so I think it's just a matter of doing the best we can with the evidence that we have and collective voices, and just trying to find the right people that potentially have some influence. So I know that's not an excellent answer. That's just been my experience.
Great, and so I think we're out of time here. So Katrina, if you could introduce our next speaker, and Liz, go to the next slide, please.
So I just want to thank you all for your questions. I apologize if we didn't get to them. Please do feel free to follow up if there's something, more information that we can provide. So it is entirely my pleasure to finally introduce you to Dr. Elizabeth Day. Elizabeth is the Assistant Director for Policy Engagement at Project 2Gen, which is located in beautiful Ithaca, New York, United States of America. I want to start by thanking you for being here. I know it is a very, very big day in the US today, and you probably could be watching a big event with a new president coming on board. And so I want to thank you so much for taking time today to be with us and to share some of your experiences with your project at Cornell University. So welcome, Elizabeth, and over to you.
Great, thank you. Let me just get my slides. Well, thank you again so much. It is my pleasure to be here. It's been really amazing to work with Katrina and Megan and kind of see this project and this initiative go from just ideas and conversations to this really amazing launch event and seeing everything it's come to be. So again, my name's Elizabeth Day, and I'm the Assistant Director for Policy Engagement with Cornell Project 2Gen. And I actually started with the project as a postdoctoral fellow. And so it's been great that I've been able to stay on and move into this assistant director role. So what is Project 2Gen? Cornell Project 2Gen launched in 2017, and with a launch event very similar to this one, but in person. And we really focus on addressing the needs of children and their caregivers together. So we're really hoping to capitalize on that strong connection between caregivers' well-being and children's healthy development. And we think about that very broadly. So really any kind of caregiver well-being and any outcome for children's healthy development when we're thinking about our projects. And we're housed in the Bronfenbrenner Center for Translational Research at Cornell. And the BCTR, as we call it, houses lots of projects that do work trying to bridge research and practice. And Project 2Gen is unique in that we also really have this bridging research and policy piece to our work. And these are our founders and current directors, Laura Tack, who's an associate professor of policy analysis and management, and Rachel Dunafin, who is also a professor in policy analysis and management, as well as our dean for the College of Human Ecology. And Project 2Gen really came out of their conversations with community partners from across the state who had said, you know, we really wish we had a better way to kind of get in touch with researchers to really try to bridge this research policy and practice divide that seems to be kind of be everywhere across the globe to bridge those gaps. And so that's where then Project 2Gen really came from. 2Gen stands for the two-generation approach. And this graphic is a really good way to kind of see what we're talking about in terms of the two-generation approach. It's really this whole family perspective. So on the ends of this spectrum, you can see, you know, that there are some programs and research and policies that focus just on children, and some that focus just on parents or caregivers more broadly. But as you kind of move toward the middle, we're really thinking about the whole family. So a really good example of that coming out of the COVID-19 pandemic has been this idea of virtual education. So some people may be studying kind of how virtual education for children is impacting their academic outcomes. That'd be a really child-focused perspective. Some people may be looking at how it's impacting parents' ability to work or employer productivity. That's really the parent-focused kind of side. The two-generation approach would say, let's look at those all together. So really, let's think about the whole family impact of what's happening when kids are at home for virtual learning while their parents are also there, or if their parents work or trying to do work at the same time. So really thinking broadly around programs and research and policy that have this two-generation lens. And the mission of Project 2Gen is really kind of three-pronged. So I'll go into detail for each of these, but first just to list them. Our first goal is to really build a vibrant research community around the 2Gen framework. We also want to connect researchers, practitioners, and policymakers whose work supports families throughout New York and beyond. And this is really, again, a huge portion of our work is really trying to create these bridges among these different groups of professionals. And then throughout all of our work, really working to engage Cornell students in 2Gen translational research and practice. So giving students the opportunity to see how this bridging works and how these collaborative partnerships work, and also do research around the two-generation perspective. So in building a vibrant research community, we've really kind of tackled this in a variety of ways. So the first and pretty obvious one is that we conduct research with a 2Gen lens. So we do our own empirical work around a variety of topics, and I'll give an example later, but really kind of looking at different ways we can take research questions and frame them in a two-generation way. We also support faculty that are doing 2Gen work. So when we first launched, we were fortunate enough to have seed funding that we could use to fund little mini grants for faculty across campus. And so we broadly looked for faculty who were doing work that really took a whole family perspective, but didn't call it 2Gen, and brought them together and said, here's this framework that we're really trying to operate under, and here's who we are as Project 2Gen. And here are other scholars across campus that are doing two-generation work. It may be in a completely different topical area, but you're both kind of taking this whole family approach, and giving them the opportunity to network and meet each other and work with our team around some of the benefits and challenges of doing whole family work. And then we also host conferences and symposia for faculty around the 2Gen framework. So you can see in these images some of our research briefs that show some of our work, as well as we host a biennial Uri Bronfenbrenner conference through the BCTR, and Project 2Gen had the opportunity to kind of spearhead and guide that conference and have a focus on the two-generation framework, particularly in early childhood development. So as I mentioned, a really big portion of our work too, and our approach to our work, is connecting researchers, practitioners, and policymakers. And as Assistant Director for Policy Engagement, that's obviously the area that I really think the most about and work through our project. So we build relationships with community partners and Cornell. So that means we as a team are building relationships with community partners, but we're also really kind of facilitating those connections with other faculty at Cornell who, if it makes more sense for them to build the partnership, really serving in that, I think either Megan or Katrina called it more of like a brokering role. So really trying to match make between these two groups. We support program and policy leaders in integrating the 2Gen framework into their work. We think about kind of how we support families very broadly. So in terms of the types of groups that we work with, it's really any organization or policymaker who's doing some sort of work around families or youth. And we help them really think more about how they can strategize integrating this two-generation framework to their work. So for one example, when we paired with a residential treatment facility that's in our local area, they were really interested in how they could do more with engaging families of the youth who lived maybe further across the state or didn't have great communication with their teenager when they were living in the residential facility. And so just helping the community partner really think about how they could improve those types of communications, and then also study and measure how well they've done in terms of training staff and building out those types of supports. We also strive to really be responsive to emerging community needs. And as COVID-19, as we all know, caused, excuse me, huge pivots in a lot of the work that's happening across the communities. And so we really have tried to, in lots of open communication with our community partners, kind of help pivot our work with them to be responsive to emerging needs from the pandemic. And then we also bring together faculty and state policymakers. So again, this is a really big part of my role, is that we really wanted to create more opportunities for faculty and state legislators to actually sit down and talk to each other. So every fall, I work with our government relations team at Cornell and talk with them around what types of topics is going to kind of come up in the state legislature in the next few months. And then we spend the spring semester, I teach a class on bridging research and policy, and we spend the semester planning an event to find which faculty would be the best to kind of speak to policymakers on whatever topic we've identified, and then actually have that happen. So this obviously used to happen in person and now has gone virtual, but it really helps kind of bring together faculty and policymakers in a setting that is really intended to just open up lines of communication on topics where policymakers may not have had as much of an access to researchers to use throughout the decision-making process, and then also really help faculty kind of have more of that policy perspective around how they can frame their work and dissemination tools to make them better and more usable for policymakers. And then also, as I mentioned, we really try to engage students in all of our work. So I teach graduate and undergraduate students in the policy course on bridging research and policy. We support summer interns, and we have students all year round, but I wanted to note summer interns because we found that that's a really great time for students who need or want summer funding to be able to be fully embedded with our community partners. So instead of kind of being more on campus and more working with us like they usually are during the semester, during the summer, they can actually go and work and be fully engaged with the community partner working full time. And then as my third bullet mentions, we connect students with community partners to kind of do some of this work. So in these photos, you can see some examples. The top one are students presenting around the adverse childhood experiences with a community partner in the eastern part of our state. Then you can see Rachel and Laura and one of our students presenting her poster at a research symposium. And then the bottom photo is another one from our Albany trip where the students help plan that event, and then they actually get to sit in on meetings between faculty and legislators and get to kind of see how those discussions play out, both from what researchers are presenting and then also what policymakers' needs are. So just kind of one specific example of one of the topical areas that we focus on is our Opioids and Family Life project. And this is a project that, again, came out of working with community partners of parent educators who were saying, you know, we're really seeing an uptick in the amount of families that we're working with who have a member struggling with substance misuse. So this project launched about 2 years ago, and it really came out of this idea that a lot of the kind of communication and talk around the opioid epidemic at the time was focused on the individual. So here's someone struggling with substance misuse. How can we support them or treat it, and how can we prevent it? Talking about the medical side of it, the drug supply side, really kind of that individual approach. And our thought was, you know, we really also need to think about some of the consequences for family members. So thinking more, stepping beyond the individual kind of research side of looking at the individual and taking that whole family approach to what's happening to the family. And we were funded by the William T. Grant Foundation's Institutional Challenge Grant to do this work with our community partner. So just some examples. That's been a very long project. So these are just a few examples of some of the work we've done. But first, in the research side, we did some descriptive quantitative analyses on the prevalence of families impacted by opioid misuse. So again, kind of stepping beyond what's the prevalence of individuals who are struggling with substance misuse and how many families are being impacted. And then we also did qualitative interviews with families involved in family drug treatment court in our community. So family drug treatment court is really kind of the intersection of drug courts and child welfare services, working together to support families, kind of going, instead of the traditional child welfare path of child removal and families going through the court system, it's really more working together to try to get children back into their homes faster. And so we did this project really kind of, it was a fully collaborative model where we connected research, practice, and policy throughout this project. We continue to do it now. But we, so for example, presented our work to state legislators on the whole family impact. So really kind of bringing their attention, you know, this is not, we need to be thinking about entire families, not just individuals when we think about the opioid epidemic. And then for the example with our qualitative work, we designed that interview protocol with our community partner, with the family treatment court leadership, to really try to have pieces of that be what specific things they could change, and what feedback did participants have for them, as well as kind of broader questions around what was happening for families and their experiences in drug treatment court. And then again, throughout this, we've had students involved in our various parts of the projects. So as I mentioned, students take part in the policy class that I teach. We had multiple community partner students who were community partner interns, which is also one of the ways too that students can really build relationships and then also represent Project 2Gen to help us build relationships in that work. And then students also, we have 3 current undergraduates who are using some of our data to do their honors thesis projects. And so not only are they getting to do that interaction with a community partner and seeing how this works, but then they're also getting to use some of that for their coursework, which is really great. So just a few lessons learned then, kind of reflecting on Project 2Gen and our work that we've done. One of the biggest ones is really having patience and persistence and mutual respect with everyone that we work with. So the patience kind of comes from the time that it can take to build these partnerships. So really, you know, it can be a long process of building partnerships, which I think Megan and Katrina have already started a really solid foundation of that in terms of trying to really have kind of mutual conversations around needs and how those needs can be met through the hub. But then also having persistence around not just grants, which can also be something where you need to have a lot of persistence to apply to a lot of grants and have funding come in, but also in sustaining those partnerships. So Katrina had mentioned, you know, making sure that it's not that the project is funded and it gets done and then it kind of ends with that it's really something that can continue longer term. And then through all of that, having mutual respect kind of across and between the different organizations. We've also had to be really creative in finding ways to bridge research, practice, and policy that benefits everyone that's involved. As we all know, the kind of common gaps that have formed between really traditional academic outlets and some of the more practical needs of professionals and policymakers. And so finding ways to do projects that can both have something like a peer-reviewed publication come out of them or really support student learning that simultaneously are going to help the practitioner and the policymakers has become really important. And then also having fun. We, as a team, Rachel and Laura do a great job of not only having just our core Project 2Gen team, which are Rachel, Laura, myself, and we have a project assistant, but also any community partners that we work with or students that are involved in our project, taking time to have different events with each other. Pre-COVID, those were in person, but now virtual, just to spend, time together getting to know each other outside of kind of the confines of the specific project, which not only makes the work more fun, but I think also can help us work together as a team between research, practice, and policy to really make sure that everyone's kind of getting the benefits of the partnership. And that is all. Thank you so much again, and I'm happy to answer questions either now or this is my contact information if you'd like to reach out after.
Thank you very much, Dr. Day. We did get a question from Dr. Melanie Rock. She says, great idea about leveraging your policy classes to plan an annual event. And was wondering maybe if you could expand on this a little bit, as the Community Health Sciences Department has both an undergraduate honors class on health policy as well as a graduate course in population and public health. And so trying to think about how maybe we could incorporate that type of approach here at our university.
Yeah, so it is a really fun class to teach and a really fun project to do. So essentially kind of the timeline of what that entire project looks like is that, as I mentioned in the fall, I do a lot of work with our state relations team. We've also done interviews with legislators themselves who we have good partnerships or we had pre-existing relationships with, to ask kind of what are some of the pressing questions that you have around families in the state that you feel like there are some information gaps. So where you're not quite sure, you know, what's happening in our state around it, or you're not quite sure how to kind of solve that problem, or different strategies for approaches you could take to solve it through a policy lens. And so after we kind of gather that information from the legislators, then I work with Rachel, who's also our dean, to talk about, you know, who across the university do you think would be a good person who could speak to this, you know, if we pick of these different topics, which one would we be able to speak to from Cornell faculty? So then in the class, the students then learn about kind of, there's a broad research base around bridging research and policy. So we do a lot of reading about theory behind kind of how research and policy work together or don't. We read a lot around kind of the public perception of science and what it means for legislators when they hear the word science or when they hear the word research. So in the class, we dig into a lot of those issues. We talk a lot about the US kind of government system and the two-party system, and really kind of getting an overview of what a lot of it honestly is kind of elementary, like let's return to our roots of the government system and how that works, and then really see how that plays out. And then the students play a really key role after they've kind of learned those things and the best practices for communicating with legislators, and they actually become the experts with the faculty member. So they do a lot of legislative history writing and legislative analysis for the faculty member. And then the students are the ones who are briefing the faculty member. So for example, they might say, here's your area of study, and here are the many policies over the past year that have related to this area of study. Here are some of the key players that are really thinking about your area of study. And so they are taking the kind of legislative side and helping faculty learn more about that. And then that culminates as well. Simultaneously, we're planning this event where we're reaching out to offices of legislators and saying, you know, we have this expert. We would love for you to, you know, if you would like to set up a meeting with this expert or attend this presentation. And then the day of the event, in the past, we've done a morning panel with usually 3 faculty members presenting on their work, and then one-on-one meetings in the afternoon. Our virtual event this year, we're actually just going to do the one-on-one meetings, and it's usually with a legislator or a legislator and a few of their staff will join as well. So that's kind of the main event that happens.
Fantastic. Thanks so much for that insight. Definitely gives us lots to chew on.
Yeah.
We're unfortunately out of time for questions, but I do encourage you to connect with Elizabeth through her email address posted there. And we're going to take just a 5-minute break, coming back at 10:55. Thanks so much, Elizabeth.
Hi, everyone. Not sure if people are fully back yet. I might give them just a couple of more minutes. Okay, I think I'll get started. I just wanted to say thank you again to Elizabeth, who really showed us how this hub could work, gave us sort of a vision for the future. When we first found Project 2Gen, Elizabeth was so welcoming and so willing to talk with us and talk through different issues with Katrina and I, and it's been wonderful to work with her throughout this process, and I'm sure we'll continue this partnership as we move forward. I'm going to talk to you a little bit about the student role. So as Elizabeth was speaking about, and as Melanie asked a question about, we see a lot of importance in the student role in the Ssv program and in the Research to Social Action Hub specifically. And in the spirit of interdisciplinary work, we work extensively, as I mentioned earlier, with the School of Public Policy, especially with Dr. Jennifer Zwicker. And we've met with her several times over the years, and it's only in the last year and a half or so that things have really sort of solidified, and we've been able to move forward in a really concrete way together, and it's been very exciting. So Jennifer and I have co-supervised two Masters of Public Policy students who have graduated now or finished their coursework, and we are currently co-supervising one student who is still on her way through Candace, and you'll hear from two of those students today. So that's very exciting, because in a similar vein to what Elizabeth was talking about with the Family and Opioid project, this project will hopefully give you an idea of what's possible within the hub and some of the ways we work through some of the practicalities. So I think addressing some of the stuff around funding, when we began this COVID-19 work with Calgary, with Cerebral Palsy Alberta and the Calgary Ability Network, we managed to apply for and receive funding through MyTax and the Kids Brain Health Network. So that supported Ash and Jessica's work with the task force, so that they were able to do their capstone and then really spend a lot of time working with the community. So they weren't just going into the task force, taking their data and leaving. They were a part of the development of the work of that group, and really walking hand in hand and collaborating and really taking a very important role in the work that that group did and continues to do. And same with Candace. So Candace is also funded through that program. And that's a very important piece for sure. I just want to make sure I catch everything before I show you something, which is the practical outcome of some of their work. So beginning in April or May of 2020, and when we really began to sit down as a task force, the group was working on re-entry strategies because restrictions were sort of starting to ease, or we were starting to talk about restrictions easing around COVID-19. But really, it's become about the experiences of marginalized people, especially people with disabilities and their families, looking at the ways in which the COVID-19 response has met their needs or not met their needs. And certainly we know that the impact upon marginalized people, the pandemic, has been particularly devastating. So I would like I'm just going to share my screen for 1 second, if that's okay. Thanks. This is kind of spontaneous of me, so sorry to throw things off if I'm doing so. I wanted to show you, this is the project that our 3 students were working on, and this is a report that they released, and it's been disseminated through their networks and through the School of Public Policy. And I'd like to invite you, if you'd like to email me, I can certainly send you a copy of it. It's a small report on some of the work that's been done, and this work is ongoing. But it talks about, I just wanted to give you a quick little overview. It talks about how the task force was an initiative of Cerebral Palsy Alberta and Calgary Ability Network, and it was a collaborative effort with self-advocates, academics, and government. We met weekly, and the students as well, and the students really guided a lot of this work. They worked hand in hand with the organizers of this task force and really were instrumental in getting this work off the ground. So first of all, we started with doing an environmental scan of best practices at municipal, provincial, federal, and international levels. And over time, and speaking with people in the community and speaking with the task force, we realized there was 4 overarching priorities: going out and staying in safely, family stress and support, transportation, and safe and inclusive design. And so subcommittees were formed around this. And then we had a town hall in which we spoke with policymakers and decided on some priorities moving forward. And we created the practical outputs of a communique about masking bylaws and impacts on persons with disabilities. I spoke to several media outlets about it, and we distributed a communique through our networks. We've also been working on the plain language version of that. And we've created a safe decision-making tool for persons with disabilities, looking at going out in the community. An in-home guide for families accessing services, a guide for transportation service providers, and we've worked with Calgary Transit on this, and inclusive and safe guidelines. So, and then moving forward, Candace will tell you a little bit about that, but moving forward, we're going to be speaking specifically with people with disabilities and their families via an online survey, which is nearly ready to launch. And so please stay tuned. So I'm just going to stop sharing. Okay. Thanks for that, for giving me the control over the screen there. So I think that a good place to start now is to talk about Jessica's work. So Jessica couldn't be here today, unfortunately, so I'm going to present her slides for her. And I'm sure I will not be doing such a fantastic job as Jessica could have done, because she's amazing, but she's prepared slides for me in any case, and I will do my best to get through them. Let me just put this up and go into my slideshow. Okay, so I think it's useful, possibly oversimplistic, but useful to think about the work of these 3 Masters of Public Policy students in terms of Jessica looking at how community organizations wanted to engage with academia and policymakers around COVID-19, co-designing pandemic responses, and thinking about Ash's work, who's going to speak after me, looking at policymakers and how they work with, or would like to work with, organizations and community around developing pandemic responses. And then Candace is going to be speaking about ways in which people with disabilities and their families might like to interact with organizations and policymakers in terms of influencing some of that pandemic response. So Jessica's work was supervised by me and Katrina and Jen, and she looked at academic, community, and political engagement, co-designing pandemic responses. So she defined vulnerability as economic need, physical need, and social need. Social vulnerability that is exacerbated when families are prevented from comprehensively accessing services needed for daily function. So I think that that's a pretty broad definition. It's not as explicitly talking about being made vulnerable, but it is within that theoretical lens. And Jessica is certainly familiar with that and has taken that perspective in her work. She speaks about evidence-based practice in the community, integrating patient-centeredness. This is just the overall sort of definition of it, expertise in clinical evidence to provide the safest and most effective services to families. There's often, so when we speak about evidence-based work, though, there's often a disconnect between the research, collection, and analysis, the evidence, and a translation of these practices into community-level services and to policy. So when we look at pandemic preparedness and community organizations, as we've said already, it highlighted issues that were pre-existing and have only been made worse by the pandemic. And one of these is knowledge mobilization challenges. So it's difficult for community organizations to engage in service continuity planning because we don't know what's going to happen. And it's very difficult because a lot of programs have had to shut or are trying to go virtual, as you all well know. So COVID-19 and its impact and the slow sort of knowledge mobilization, I think the development of evidence itself has, of course, takes time. And then how we respond and are prepared for a pandemic, it's not really, the evidence has not really been accessible. So this was Jessica's methodology. She used this research question: what barriers have you encountered as a community organization serving families made vulnerable through COVID-19? And what barriers have you encountered that have impeded the delivery of evidence-based services in the community? And how would your organization ideally like to interact with government to address these barriers, i.e. to impact policy? So she had 24 participants, and exclusively they were organizations working with families that were made vulnerable in Calgary. So she used what's known as a nominal group technique. And interestingly, it's this basically the same type of technique that we're going to be using in the afternoon, although the way we'll do it in the afternoon is much more flexible. This one is a very distinct approach, and it has various stages. It's a great technique if you're looking at very pragmatic research, trying to get to an end result in which you've got some kind of output that's going to be used for guidelines or that's going to be used for policy recommendations. So the first thing people do is write down their ideas and then share their ideas and then clarify those ideas, put them into categories, and then people are asked to rank them, and they must reach consensus on that ranking. So she did her focus groups on Zoom, obviously, and then she developed her themes. So these are the barriers that she found that these community organizations reported. Revenue loss. So it's financially hard time, and then there is a sense, according to this participant, that we get territorial as organizations and we get worried, and maybe it's more difficult to collaborate or play nice together. The transition to online service delivery, data in many ways supports telepractice, but there's still a perception that it's less than face-to-face. So I can certainly relate to that as an instructor as well. You know, the data tells us that it's just as good to teach online and that we can connect with each other online, but in practice, there is a perception that it's less effective or it's not as impactful. There's also, of course, a sub-theme of hardware and software, digital literacy, of course, and capacity of staff to handle this new type of service delivery. And then there was inadequate communication and collaboration with government. So importantly, almost every participant, so it was a very important strong theme throughout her research, mentioned that COVID-19 directives from government were too vague for service continuity planning. So how are we going to keep on delivering these essential services to families? How can we plan for this? How can we support families through it? It was very vague for participants. Sub-themes included insufficient guidelines, lack of sector-specific guidelines, and inconsistency. And facilitators, so things that made it easier to access evidence-based practice during COVID-19 were person-centered policies and programs, you know, sort of adapting things to different groups and their unique needs. And as we keep going back to reciprocal partnerships to the facilitation of person-centered policies. Collaboration is really powerful, and maybe we should be focusing our time on figuring out how to do that between organizations. That was a very important theme in Jessica's work. And here is what she came up with for policy recommendations. So this first one is the education and consultation with community organizations. So more consultation, more two-way really education and sharing of knowledge for provincial leadership around service continuity, why we need service continuity, what that needs to look like, technological assistance, and staff retraining. So more support really around how to continue offering services under various types of circumstances. Subsidies and grant provision for community-based research. This is something that comes up in every single one of our talks today, really, and probably in our work constantly as well. Shifting focus to long-term sector sustainability ideas and sort of changing this short-sighted funding and grant focus and those cycles, thinking more long-term. And importantly, the disruption of siloing by creating a local network of researchers, community organizations, and policymakers can work together for a faster knowledge mobilization. Like Elizabeth was speaking about, having that day where academics and perhaps community and policymakers sit down together and share knowledge and communicate with one another about what's going on. That sort of model is really looking at this faster knowledge mobilization, and that's something that we would hope to move towards as well. Yeah, and this is how Jessica's work was supported, as I mentioned earlier. That's the Kids Brain Health Network, MyTax, School of Public Policy, us, and Cerebral Palsy Alberta. So importantly, Jessica continues, although she's graduated, and I know it's often a challenge, as many of us know, that once you're finished of your capstone or your dissertation or your thesis, that often it doesn't get published. But Jessica has been busy writing, and she's already created various types of reports at different levels, and she's been accepted for publication at the School of Public Policy's publication, and she'll continue to work towards disseminating this as she moves forward. And I think I'll stop sharing that now. Does anyone have any questions on Jessica's work?
Just wait a minute to see if anybody has a question to go through the chat box.
Oh, and I just want to remind everyone that report that I showed, it also includes the, this decision-making tool that was created and the other pieces that were created by the task force thus far. And so if you'd like to have a copy of it, just email me and I'll send it to you.
Okay, we're not seeing any questions. So Megan, if you want to introduce our next speaker, Candace.
Great. So this is Candace Parsons, and she's a current student doing her master's in public policy and co-supervised by Jen and myself, and Jennifer Zwicker, as I mentioned earlier. And she's also been working closely with Cerebral Palsy Alberta and this task force looking at impacts of COVID-19. And yeah, she's going to be talking about what her project is going to look like moving forward.
Bear with us just one moment as Candace gets set up here.
can everybody see my screen?
Unfortunately, we're just seeing you right now, Candace.
Oh, okay, just bear with me here. I'm not sure why this isn't working. Let's see. Okay. The joys of Zoom, right? For some reason, it's not allowing me to access my actual PowerPoint presentation. So I'm going to try and change this in my systems. It worked when I tried using this yesterday. So I'm not sure why it's not working today, but it's asking me to open the system preferences to allow security access, which is strange. I've never had that come up before. So
Okay, Candace.
Candace. Oh, sorry. Go ahead, Natasha. Sorry.
Megan, go ahead.
Oh, I was just going to say, if you want to email your slides to me, I can advance them for you.
Yes, maybe we should try doing that so that we're not taking too much time.
Is that what you were going to say, Natasha?
Yes, exactly.
Okay. Well, it doesn't look like it's working, so I'm going to have to do that. I can try one more thing quickly before, and hopefully that will work. And if not, then we will do it that way. Okay, so sorry about this. Let me quickly email this to Dr. Edwards. I'm not sure if Ash would like to go before me, so that way we can sort of not waste too much time. But...
Ash, if you're all set and ready to go, we could go to the next speaker.
Absolutely, I am ready, and yeah, I can go ahead.
Perfect.
Okay, do I have share screen? Okay. Okay, just a moment. Okay, hello everyone, my name is Ash Seth, and I'm a research associate working at School of Public Policy with UFC. I would like to give my thanks to give me this opportunity to come and speak and share about my research. Thank you, O'Brien Institute, and most importantly, thank you, Doctors Megan Edwards, Katrina Milani, and Jennifer Zucker to help me shape this project and just to come up with a beautiful research. So without further ado, here we go. So my research focused on how governments could engage community organizations to co-design COVID-19 pandemic response policies. And it was a case study on government of Alberta and the response during COVID-19 outbreak in Alberta. So the research purported to evaluate strategies and measures through which decision makers could engage community organizations to participatorily design disability inclusive policies during COVID-19. The study attempted to also understand what's the level of engagement of stakeholders at this moment, and what are some barriers and facilitators to the engagement of stakeholders like community organizations when it comes to designing participatory policies. In order to accomplish these objectives, we conducted qualitative interviews, semi-structured, with key decision makers from Government of Alberta, like various ministries like Ministry of Community and Social Services, Ministry of Homelessness, and Disability Advisory Group like COVID-19 Advisory Group that is being spearheaded by Minister Carla Caltro, and municipal government levels as well. The research gave us some interesting key thematic areas. The interviews led to following policy themes. One is about stakeholder engagement environment for co-designing. Just a second. And here we explored what are the barriers to engagement when it comes to co-designing policies. What are some approaches or facilitators to overcome these barriers? Moving ahead, we also focused on communication plan during COVID-19 pandemic, for persons with disabilities and the community overall. And we wanted to understand whether the plan is adequate or not. What is the stakeholder engagement level in that plan? Followed by monitoring and evaluation. Similarly, we wanted to understand what are the assessment mechanisms currently in place, and whether there are any key performance indicators that have been defined or not. And finally, we wanted to understand stakeholders' opinions and viewpoints on if a social policy hub could be a preferred co-design approach, and if yes, then how is it? Oops, oh, there you go. We had some really interesting findings, and because of the limitation of space and time, I'm not going to discuss everything right now on this platform, but would be happy to chat later or send my reports. So the findings were divided based on various policy themes. One is engagement environment, pandemic communication, monitoring and evaluation. In terms of understanding what are the barriers to engagement, many participants expressed their disconcern about inaccessible ways of engagement approaches, like not having inclusive elements like accessible buildings, lack of special transport for medically fragile, or lack of consultation tools in plain language when it comes to consultation sessions or surveys. Fear of participation is huge when government officials and different stakeholders like community organizations or funded organizations, frontline workers who are working in government-run institutions, when they are placed together, and because of the repercussions, what may happen if we speak up. So that was also one of the engagement barriers. In terms of overcoming barriers, obviously many participants shared that having accessible approaches like, accessible venues like including washrooms, accessible presence of ramps, presence of closed captioning during presentations and communication, use of plain language when disseminating surveys or any forms, that's really helpful for them to engage on a more holistic way. Participants also, kind of focused, share that we need innovative practices where there's less fear of speaking, where there's less set of technical questions and more database, a richer database could be generated based on stories, based on inputs, personal experiences, and perhaps a segregated form of consultation rather than bringing everyone together. Moving ahead, we focused on pandemic communication. I'll refer to my notes here. Different levels of government, along with advisory committees, share their disappointment due to lack of plain language documentation approach. This came over and again. Participants expressed their disconcern, basically, that COVID-19 reentry communication strategies for schools, for transportation, for public spaces are generic, and they do not involve adequate guidelines for specific disabilities. Moving ahead, we also understood whether the outreach is strong enough or not in various areas. Folks who are in the rural communities, they had their issue that the outreach is weak. We do not have access to enough information, and it's primarily the community organizations who are the first point of contact for people living in the rural communities to understand more about the pandemic. And finally, about monitoring and evaluation, which was our third theme, we wanted to understand whether the assessment mechanisms are adequate. What are these mechanisms? Whether the government of Alberta has defined any clear-cut key performance indicators. And unfortunately, what we saw that the discussion was split into opinions. While one side of the government, provincial government, said that they have various mechanisms in place. They have hired impact assessment agencies to continue with this impact assessment process. The municipal government said that we haven't seen any robust mechanism plan, and whatever the mechanism ways are, basically community organizations logging their feedback through accessibility helplines or through discussion meetings with government folks once in a week. But we haven't seen any particular data surveillance in terms of impact of pandemic on unemployment, mortality rate, morbidity rate for persons with disabilities and families. There was a lack of key performance indicators when it comes to evaluating the response. And I just want to focus on this fact that when we conducted this research, it was during the months of May, June, July, 2020, and pandemic response was also reactionary at that time because the dynamics were ever changing and governments were also kind of formulating responses to changing approach, changing epidemiology of pandemic. All right, viewpoints on Social Policy Hub. This was a key question of interest. We wanted to understand governments and participants and advisory levels opinion on if Social Policy Hub could be a beneficial approach for co-design. And many participants affirmed that yes, it's a beneficial, innovative approach to support the process of participatory policy making. Participants were of view that it's a value-based approach because academia, community organizations, and together with government could bring independent scientific lens that could complement some strategic priorities of government, perhaps like getting Albertans back to work, reducing poverty, getting back to reducing unemployment here. And participants were also of the view that Hub could create a systematic culture and there could be a cross-cutting theme like poverty that could be represented by various cross-ministry like Ministry of Health, Ministry of Education, Ministry of Social Services. Moving ahead, many participants share that Hub could be an innovative consultation approach where fear could be less when it comes to participation. A caveat was presented by many participants that you can't involve everyone together in a same room and request people to speak up because that's not going to happen when different parties are presented. So perhaps have separate stakeholder consultation, and Hub could be instrumental in doing so. Finally, connection-oriented approach. Participants from the government side said that due to implementation issues, various priorities, limited budgets, resources, governments sometimes become insulated or perhaps complacent from meaningful consultation. And approach like Hub could help decision makers to gain a deeper appreciation of their lives, of communities, families, and individuals. Are there any preferred ways that government prefer to be approached by community organization or stakeholders for co-design? Yes, there are. Many people said that community organizations, unfortunately, are still on the silo-based approach. When they approach government, they are having their own particular priorities. So government would like them to come up with shared priorities, forming task force or collectives, and then solicit them. And it's a time-consuming process. It doesn't happen overnight, because different governments have different priorities, mandates, and budgets. So to get on a multi-year agenda is very important here. We need community organizations to be respectful when soliciting government, particularly during health emergencies. We have seen that the responses or the feedback is pretty aggressive in those ways. And rather than echoing barriers, perhaps community organizations could come up with the solutions because they are the stewards who are going to implement the solutions and they know what's best for communities. Okay, so any particular policy recommendations? Of course, we request and recommend government to make financial investments to create accessible engagement environment because it creates a level of transparency and trust and ups the participation level. We know Canada Accessible that the Accessible Canada Act was an expensive engagement process, but it was needed so that government could interact with the participants in a more meaningful ways to establish a barrier-free Canada. Just a second. Professionally engage, we request governments and suggest them to professionally engage stakeholders like community organizations to co-design critical pandemic aspects like plain language communications, plain language communication tools. And many participants suggested that, yes, this is something that we need from community organizations when it comes to co-design. But just saying is not enough. We suggest governments to help them build their capacity, acknowledge their expertise, perhaps contract the community organizations and experts to do that, so that later on, if there is any tweaking to the plan, it's cost effective. And community organizations basically know what's the pulse of community, who needs what according to their needs. Perhaps different disability groups could benefit from this approach, and we think that it's an equitable approach in that sense. And yeah, continuously engage with variety of stakeholders, including caregivers, researchers, community organizations, for conducting impact assessment in various areas like health, like employment, tracking mortality, morbidity rate, and here defining key performance indicators right from the beginning could be a very beneficial approach to measure pandemic's impact. And finally, disseminate information and evidence on how input of stakeholders is shaping policy responses, because shows the evidence that how various feedback sessions, consultation approaches and those inputs are reflected into the policies. Perhaps Government of Alberta could also publicly disseminate the information how its own advisory group on status of persons with disabilities, Premier's Council, is instrumental in informing decision-making that reflects priorities of vulnerable groups. These are some participant quotes. I could read it, one of it. Maybe the Federal Advisory Group participant, second quote, governments could play a significant role in contracting disability groups to design and implement pandemic messaging and acknowledging their expertise. Perhaps first, provincial government participant, community organizations must be categorically included in the consultation process of pandemic response plans as their community's eyes and ears. Well, that's pretty much it. And I would like to acknowledge the School of Public Policy, University of Calgary O'Brien, Institute for Public Health, our partners, Cerebral Palsy Alberta, funding partners, Mitex and KBHN, for making this research a reality. I'll be happy to take some questions if you have. I'm just gonna stop sharing here.
Fantastic. And if there's any questions for Ash, please pop them in the chat box and we'll just give people a few moments to type out anything. So we've got a question from Katrina, wondering if there was anything in your findings and your work that you've done that was surprising to you.
Absolutely, absolutely. That's a great question. And there are next steps to begin to see meaningful change. Perhaps, we are talking today about social policy helps. That's one of the stages. And many times, I think what we have seen is that, we spoke about status, Premier's Council on status of persons with disabilities. So next step, in short term, it could be defining, or letting public know that, yes, there are 9 members on the team here, and what is the mandate of each member and how this whole committee is influencing policy making, particularly during health emergencies, because they are also kind of a bridge between community organizations and the government. Many disability communities reach out to them to talk about the issues and concerns that range from medical policies or visitation policies or school guidelines for not being so specific about children with disabilities. So that's the short-term step. In long-term, we could think about COVID-19 advisory groups. Perhaps this group's mandate by Minister Carla Qualtrough could be extended beyond pandemic, because we are going to see the impact even after waves on various areas like employment, education, literacy, and different areas. What we have seen is that due to medical and cultural barriers, many persons with disabilities could not partake or have this inadequacy, but still the need of engaging with government in the policy making, and perhaps here families could play a critical role in the engagement process for participatory policy making. So a research could be conducted out there, and it's a whole new field there. Thanks, Katrina. I hope I answered your, sorry, it was Anne. I hope I answered your question. Yeah, sorry, Katrina said, was there anything that surprised you? Oh, yeah, there was some surprising moment, and I'm just gonna refer, can I share my screen, Natasha, please?
You should still have
Okay.
co-host abilities. Yeah.
Okay, yeah, I guess, yeah, there was something surprising here. So, I think this preferred ways to approach for co-design was quite surprising, you know, especially when governments, how they want to be consulted. And from community organizations, you know, we always think, you know, on the one side, we must get on the agenda. We must solicit the government at this moment. And sometimes what happens, it becomes very aggressive, and same voices are echoing over and over again, rather than providing solutions. So first of all, government wants to be engaged in a very respectful manner. And for that, there could be some code of conduct. Perhaps community organizations could come up with something like that. And also understand that it's not an overnight process. The change is not an overnight process. And it's going to take time. There is agenda for the government also, but just find some common priorities between the community organizations and the government, and perhaps see what's the low hanging fruit first, and then go for the higher aim. Again, silo-based approach was something that kind of surprised me, that many community organizations want favors for their own community. For example, deaf and blind community would want that. Our community for schizophrenia would want this mental health issues to come forward. But you know, during this time, we have to be together, as we are saying, let's stay far, but stay together. So come up with shared priorities, formulate task forces, committees, basically to solicit government. So this was pretty, you know, kind of surprising to me. Again, one of the incidents that I could remember, I hope I'm not taking a lot of time here.
1 more minute.
Yeah, regarding visitation policy guidelines in the hospitals, many participants talked about this thing, and it was highlighted that families were unclear about protocols in the early days involving assistance to patients with disabilities who have difficulty communicating their needs and consent to medical staff. So because of this unclear protocols, inadequate communication, it all exacerbated their mental health issues and isolation, both for the families and persons with disabilities. Perhaps there were absence of lack of kind of technology or voice boards through which persons with disability could communicate their needs, their consent, their denial in the earliest days of pandemic. And that kind of increased the risk level of patients with severe disabilities. And that's why everyone is saying, and you're reading it in the research, that persons with disability are at higher risks, mental and physical, when it comes to health emergencies. So this was, you know, something striking.
Fantastic. Thanks so much, Ash.
Thank you.
And if you have any further questions for Ash that come up later, please feel free to email him. And we'll put this back to you, Megan and Candace, if you guys are ready.
Okay, great. So she has it up. Awesome. Thank you so much, Megan. And I'm sorry about those technical difficulties. So let me just get into my presentation view here so I can go through this with you all today. Thank you so much for having me. First of all, it's really a pleasure to be here. Good morning, and my name is Candace Parsons. Welcome to my presentation. Today, I'm here to discuss pandemic preparedness and meaningful engagement with people with disabilities. So here is a list of the table of contents, which represents, of course, the flow of my presentation and the topics through which I plan to discuss the work that I'm doing in the area of pandemic strategies for persons with disabilities and meaningful engagement. And so what I'm really looking forward to is discussing something that has been very impactful on my work or on the type of research that I'm doing, which is really achieving that meaningful engagement through collaborative efforts, which have been between academics, community organizations, and self-advocates as well. Can you please change the slide? So I'll just get Megan to click through here. So Megan, if you could just click 3 times. Thanks. So before I begin talking about the research, I would like to introduce myself. I'm a 2018 graduate of the Rehabilitation and Disability Studies program, and that's where I met Dr. Edwards, and she and I began developing a really great working relationship, which has stemmed into various projects. I'm currently a student of the School of Public Policy, which you've all heard, and I hope to graduate this year with a master's degree. And alongside that, I'm currently working on a capstone project with Dr. Edwards, as well as other academics from the university. She mentioned Dr. Zwicker as well. And this project is unique, right? Because it also includes these community partners, such as the Calgary Ability Network and self-advocating groups. And so my capstone is really about promoting these pandemic re-entry strategies for persons with disabilities and their family and caregivers. And the main component and the body of that research is really around the stakeholder experiences survey, which is focused on eliciting those lived experiences of the respondents. So I'll just get you to click through the next one, Megan. So very briefly, I would like to describe what a capstone project is. So if you could click twice, Megan, that would be great. A capstone project really digs into well-defined and complex issues, right? So anything from like climate change or what we're dealing with right now, which is COVID-19. A project should really contribute to outcomes, right? So it's about producing reports that can inform the public, or maybe producing briefing notes, as a lot of us have mentioned so far, which really aim to address policymakers and inform them about such issues, right? So oftentimes, briefs would make recommendations on how to address issues through the creation of or amendment to certain legislative actions. And I'll just get you to click, Megan. So now I would like to focus on the background or the rationale of the capstone project that we're working on. And through this, I will address why we decided to conduct a survey and sort of why it's important. So I'll just get Megan to click again. So while we know that the COVID-19 pandemic has had, of course, such a significant impact on the entire population, the impact, as Ash just mentioned, can be more keenly felt by the disability community. In fact, the United Nations has actually stated that the COVID-19 pandemic has exacerbated many of those pre-existing inequalities that are faced by some persons with disabilities, such as their access to healthcare. Furthermore, persons with disabilities, they may experience additional inequalities that are resulting from some of those demographics, right? So their age, their gender might come into play, but a big one is the types of resources that are available to them during this time. And so because those who have disabilities can be quite disproportionately affected by some economic and social consequences of the pandemic, their response and their recovery strategies to the pandemic, they must reflect those intersecting issues, right? So therefore, we created a survey that really was aimed at asking pandemic-related questions to persons with disabilities to gain a deeper understanding into their experiences. Megan, I'll just get you to click. So importantly, where did the idea for the survey come from? Well, Megan talked about this quite a bit, but I'll just reiterate it here. It was a strategy of the re-entry strategy for persons with disabilities task force, and that began in May of 2020. And it was a collective effort between us, the academics, community stakeholders, agency partners, self-advocates, and members of the government. I'll just get you to click again, Megan. So how did we decide what our survey research should focus on? Again, this was something that Megan and Ash touched on, but I'll just really reiterate it one more time for you here. The task force completed a widespread environmental scan of some of the best practices where some overarching priorities really emerged. And so staying within those parameters, we created the survey questions, right, which expand on some of those critical intersectional issues that are critically related to access to services, economic, and some educational supports as well. There's some mental health aspects in there, and then just general sort of day-to-day functioning. Megan, if you could go to the next slide. So why are we really putting an emphasis on collaboration during this capstone project? Well, firstly, the School of Public Policy places a significant effort on teaching the students about knowledge transfer issues. So I'll just get Megan to click through. My professors say, you know, we need to rethink how knowledge is produced and used, and how can the transfer of knowledge enhance our understanding of policy and the ways in which society truly engages with that policy. So I think that the collaborative effort within my capstone is really putting knowledge transfer into practice. So if Megan can just click twice here. So for example, to achieve the plain language design, which is transferring knowledge from self-advocates to academics, we collaborated with a network of self-advocates and self-advocacy groups across Alberta. And we really wanted to make sure that we highlighted these groups here. So we
I'm so sorry, Candace, to interrupt your flow. I do think we're out of sync with the slides.
Okay.
Maybe you could just look at what I'm clicking through, and then you will know where I am.
I actually can't, just because my screen is in.
Can't see it. Okay. So what slide would you like to be on right now?
You could go back to the collaboration.
Okay. That's what I thought we were out of sync. Okay.
And then just, yeah, if you could just pull up that list of the self-advocacy groups that we worked with.
Gotcha. All set.
Perfect. Okay. So we partnered with the Alberta Advocating for Change Together, the Southern Alberta Individualized Planning Association, and the Southern Region Advocacy Network. So this is where we have really achieved that meaningful engagement piece, because these are the most important partnerships in our design, right? Because oftentimes research methods, they can ignore some of those systemic structural vulnerabilities that Katrina was talking about earlier. And so for our, what we want to focus on is having accessible language, right? So we collaborated with these groups, which really made it possible to present the survey questions in the most accessible and inclusive way. So I'll just get you to click again, Megan. So here we are. This is a slide that sort of represents the next steps of the survey. So with the help of our community partners, we plan to recruit around 200 survey participants across Alberta. These respondents will be invited to participate in an online survey. So that's going to be via email or through social media platforms such as Facebook, Twitter, and Instagram. And then potential respondents would be directed to the survey, where they will be prompted to answer 40 questions. And I'll get you to click again, Megan. So for folks who prefer taking an over-the-phone survey, we've once again used a collaborative approach, and I'll get Megan to click to reveal that approach. So we hired 4 fourth-year Practicum students from the CRDS program, and these students are going to be assisting us with the phone interviewing process, which is a great collaboration. I'm really excited about that piece. So now we'll get into some of the actual questions from the survey. So we'll take a look. So I'll get Megan to click through. So here is an example of a question from the accessibility section of the survey. And this section asks about, access to services and resources during COVID-19. And this question in particular is directed towards family members or care providers. So the question asks, during COVID-19, have any of the educational supports listed below been available to you or your loved one? So for this question, there's 4 supports options that are listed: access to technology, online meetings, paid time off work as well to help with schoolwork, and a strong learning plan to meet the needs of students with disabilities. So here the participants will have 3 options to respond to each of the supports. So first, I'll get Megan to click. The first option here is that support was available and useful, and then she can click again. That support was available but not useful. And then the third click through is going to show that they did not have access to any supports. So this question was, of course, informed through the collaboration process, right, with the task force. And they really told us that there were potential gaps in educational resources. And so therefore, we really think that, this question, it can help determine who is most impacted by the availability of such educational resources. So for example, what age groups are most impactful, and even what socioeconomic status are they represented at. Megan, I'll get you to click through the next slide, please. Yeah, so the next example here is a question that's directed towards a person with a disability, and this is from the public health orders section. And I'll get Megan to click to put the question up. So this question asks, are you able to follow the COVID-19 recommendations, such as wearing a mask, physically distancing, or maintaining hand hygiene? So here the respondents, they're presented with 3 options to respond. So the first is, I am able to follow the recommendations. I am not able to, I'm able to follow some of the recommendations. And then the third option is I'm not able to follow any of the recommendations. So if the person were to choose the option stating that they could follow all of the recommendations, then they would be directed to another section of the survey. But if they choose that they could follow some or none of these recommendations, then they would be directed towards this follow-up question. And I'll just get Megan to click to reveal it, which asks about the level of difficulty that they may or may not have had following some of these recommendations. So they're asked to choose whether the recommendation, let's say, for example, wearing a mask, right? Was this easy or was it difficult? And so again, we knew during the question design process that public health orders could have potentially created some issues for folks, and that there may be some difficulties. Therefore, questions like these really need to be asked, to find out whether or not these types of policies and mandates impact the community and in which ways. So we're going to be going to the next slide here, and it's sort of something that I really wanted to show you, because we've delegated sections throughout the survey where the respondents can express their thoughts about different survey questions or sections. So I'll get Megan to click again. And here, for example, is the last question in the government recommendation section. And this is where we provide the respondent with the space to share any additional information about that section that they would like, right? So this is where some of the qualitative data would be collected from the survey. And here we're using a pragmatic framework, and I'll get Megan to click one more time for sort of a definition to come up. But a pragmatic framework is really where meaningful engagement comes in again. It allows the researcher to rely as much as possible on the participant's viewpoint and to develop subjective meaning of that phenomenon, right? So in this case, having open-ended questions where respondents can tell us what they want to about how COVID-19 has impacted their lives is really important, because the data that's gathered from these sections is shaped from a bottom-up perspective, and it can really empower the respondents. So I'll get Megan to click. And here we are, we've arrived at the conclusion, and I just wanted to state that as somebody who's passionate about social justice issues, I would really like to see many of these COVID-19 issues that are affecting persons with disabilities be addressed by our government. And so I'll get Megan to click 3 times. And I just wanted to highlight that our objective is that the survey respondents would have the opportunity to articulate both the successes and the challenges that they may face in terms of, current reentry COVID-19 strategies and some of the programs surrounding pandemic preparedness by the government. The goal is that the survey will help to produce evidence-based approaches, such as policy briefs that I discussed earlier, that can really formulate recommendations that are based on the needs of the community, which might then be reflected in Alberta's pandemic response plans and hopefully could lead to improvements for this population. And so that brings me to the next slide, which is my references. So that's some of the the references that have informed this presentation. And then the next slide, I'm really just wanting to say how grateful I am to be here. And I really wanted to thank you for all of your time and listening to this presentation. And it would be my pleasure to provide you with my email address or if you have any questions as well.
We do have time for 1 to 2 questions. If anyone has a question for Candace, please pop it into the chat box. So we do have a question from Anne. Thank you, Candace. This is exciting work. This may be too micro, but I am curious to know level of awareness in population about a federal government-sponsored program that subsidizes high-speed internet and other digital literacy supports for lower-income households as an important means of maintaining social contact. So wondering what the level of awareness is about that program that does exist.
Yeah, I'm not 100% sure about the exact program that you're talking about, but thanks for saying that it's exciting. We are all very excited about this survey. And in terms of dissemination, which is something I could speak to as far as you know, how we're planning on getting the survey out into the community is we're using our partnerships. So Megan had mentioned earlier about the Calgary Ability Network, which is a network of around 150 organizations around Calgary, which is also expanding right now, hopefully, to be the Alberta Ability Network. And so we're really utilizing those partnerships in the most positive way possible, which is they would take the survey and disseminate it out into their client base. And so in terms of like, you know, digital literacy and supports for lower income households, I mean, that is definitely an area within the survey that we've touched on a little bit, but it would be interesting to, you know, maybe incorporate some more of those supports for people who are dealing with issues related to COVID around those. So thanks for that question.
Fantastic, thank you, Candace. And we'll go back to Katrina Mullaney to close out this morning's session and introduce the afternoon.
Thanks very much, Natasha. And thanks so much to Megan and Candace and Ash and to Elizabeth and Elder Croshoe and Dr. Stelfox for joining us this morning. I hope that it was engaging and interesting and sets a good tone for this afternoon. Our plan for this afternoon, like I mentioned earlier, is to do some brainstorming. We have some guiding questions, some big picture things that we want to ask people to grapple with. The sessions will be facilitated, so we will put you in breakout rooms with a facilitator who will pose the questions, guide the discussion, take some notes. We will have a quick report back so that we can have just sort of a big picture conversation about what happened in your discussion groups. Yes, so very important to us. Natasha has put a link to an evaluation survey in the chat box, so please take a moment and fill that in. So we really appreciate your feedback in terms of how we did this morning and how we could potentially improve in these kinds of events moving forward. So thank you again to everyone who joined us this morning. Please come back at 12:30. We only have an hour and a half this afternoon. And this is really the participatory part of the day where we want to hear from you. So your insights and your questions and comments are very important to us. And we do want to hear from you. So I look forward to seeing you at 12:30 and hope you enjoy a lunch break and a bit of a stretch perhaps, and we will see you again very soon. Thank you all. Hi, everyone. One more minute, and then we will get started with our afternoon work. Thanks. Okay, welcome back. Let's get started. So we have, as I said, a plan for the next hour and a bit to now shift the conversation to you and to hear from you in terms of how we might begin to move this work forward in a strategic and intentional way. And so we have some guiding questions. Natasha is going to put us in breakout groups. Natasha, we are at 29 people. So maybe what we'll do is we'll have 5 groups, and that will leave you free to pop in and out if there are technical issues. And then we have 5 other facilitators who can guide 5 or 6 people per conversation. And so we have very skilled and engaged facilitators to support us through this next piece of work. And we have, I'm not sure if there's another slide or not. I think the next slide is just breakout rooms. Right, just a reminder, what we touched on this morning, that this is an opportunity for us to connect with each other, hear from each other, and start to move towards research and action priorities for the Hub and the Social and Structural Vulnerabilities portfolio. And so recognizing, of course, that many of you are already engaged in policy work, in advocacy work, in collaborations and networking, all of those great things that we've been talking about. And so again, this is an opportunity for us to learn how to leverage and build on some of the great foundational work that's already happening in the community, and to figure out with some clarity what our role could be in supporting that obviously without duplicating. And so we are looking to, we have 5 sort of big picture issues that came from our community consultation and the work that we've done so far. So these are examples and things for you to grapple with. But when we talked to those 43 or so agencies over that 12 months, these were the big buckets of priorities for folks at that time. Data was one, in terms of what I said this morning about how do we understand what data is out there, who's collecting it, who has access to it, can we share it, can we learn from it, is there value in us prioritizing work specifically around the data piece. Upstream strategies, so prevention of homelessness, prevention of domestic violence, prevention in any way that you sort of envision prevention. This was a big theme that came out. It is still fairly nebulous and hard to understand sometimes what we mean by prevention. And so would it be a priority for us to be thinking about prevention, research related to prevention, and strategies and action items related to prevention in all kinds of social experiences and social issues? Family-centered and evidence-based policy was another theme that emerged. And this is really about the co-creation, like we talked about this morning, of policy, partnership in policy development that is guided by good evidence and guided by the experiences of families and people who are made vulnerable for all kinds of reasons and in all kinds of ways. So would it be important for us to think about how we can provide policy alternatives or examine policy from that lens, for example? Systems level research. So this again is kind of what I was talking about this morning, where sometimes we use the experiences of people as a way in to understand what's happening at the higher level. So how does the Immigrant and Refugee Protection Act, for example, support or not support specifically refugees, for an example, who who have different eligibilities for services and supports depending on how they're sort of classified by our policies and our government approaches to refugee settlement. And so, you know, what is happening in health, what is happening in social services, what is happening in justice, in domestic violence sectors and homelessness sectors and housing at the systems level that we could be looking at. So would that, for example, be something that we could prioritize? And then, of course, specific social issues. So do we need to prioritize research on homelessness and housing, on domestic violence and poverty, all of those social issues that you're very, very well familiar with? And then, of course, other. These are just ideas that have come out in our consultations so far. Obviously, we live in a very dynamic environment. Structural racism, systemic racism is obviously a very important issue. It's not new, it's pervasive and it's consistent. But is it something, given the context of the world we live in right now, that we should potentially be prioritizing? So we've put these out there for you to grapple with and to think about. We also will ask you some questions around action. So what is it that we could actually do if we prioritized research in any or all of these areas that could potentially have an impact on moving the needle in some of these areas? So you will be in breakout rooms for the next 40 minutes or so. You will be facilitated through a couple of big questions. Your facilitators will take some notes. We won't be recording the breakout sessions, but we will record the session when we come back to do the report back. So I think that's all that I had to say. Does anybody have any questions about that process? Your facilitators will go through in more detail what we hope to do. Any questions though, before we jump into our groups? I'm just taking a look at the chat box. Okay. And please, any and all questions for your facilitator. Natasha and I will move from group to group in case there are questions and just to pop in and see how the conversation's going. But I will leave it with Natasha and Liz now to help us coordinate some groups. And I look forward to seeing you all again very soon.
Great, so we're gonna open up the rooms and you should receive an invitation to join your chosen room, which should have a facilitator in it. Okay, and I'm just going to keep assigning folks as they log in. Rooms 2 and 4 could use more people, other folks log in, and we'll just pause the recording.
So that we can take some good notes in our report back to you after the fact.
Awesome. So what's going to happen now is I'm going to ask each of the facilitators from the room to give us their top 2 kind of big topics and issues that came out of your discussion. And then we're going to put those issues into a final poll. So facilitators, I just noticed that we had 5 breakout rooms and Zoom limits its polling to having 10 options and a question. So if you could keep your issues to just the kind of top 2 that seem to emerge, that would be fantastic, so that we can fit everybody in. And we might see some coalescing and overlap between groups as well. So let's start. Megan Edwards, are you ready?
I was just going to say, I hope that she doesn't ask me first because I have a lot more than 5 and I was hoping to cross a few of them off. Things went, it was such a great conversation that we didn't quite hit all the points that we wanted to and coalesce everything into just 2. But I think if I can sort of identify what I heard as being the top 2, and I would suggest that anyone from my group can certainly say something in the chat if they feel I've missed something or they'd like to add something. But I think the first one might be the breaking down of silos. And that includes data sharing across organizations so that families don't have to keep telling the same story again and again, or they don't have to keep interacting with elements of our system that are not working together well. So people were talking about, Alberta Works and AISH and families dealing with the foster care system. So things just simply not communicating and working well together due to siloing. And let me just pull up my notes so I can make sure that I sort of try to get what I think the second one might be. Yeah, I think that what we want to know is how do we gather evidence that impacts policy? So how do we know what we're doing is working and what's the best ways to build resilience in families? So really around the evidence and the translation of that to policy.
Fantastic. Thanks so much, Megan. So I've written breaking down silos and translating evidence into policy. Let's move to our next facilitator, Megan Sampson. You're the next box in my window.
Hi, just had to figure out how to unmute myself there. So we had a really interesting discussion, and we had folks from sort of a variety of perspectives, Calgary Fetal Alcohol Network, Trellis and the homelessness sector, and then Calgary EMS community paramedics. And so I guess our 2 key sort of take-home points, there were lots, but a lot of them were quite interrelated. And the first one that we identified was access to and treatment within sort of acute care for folks who experience structural vulnerabilities. A lot of times, people's clientele, they stated were treated really poorly when they try and access care in the hospital. And, through their relationships, they can encourage people to access hospital care, but they're not confident that they'll be treated well and feel sometimes like they might even be doing a disservice. And there are some ideas around gauging folks' attitudes around structurally vulnerable populations, and in particular homeless people, through research and identifying training opportunities with and from folks with lived experience, and addressing burnout and how practice self-care. So those were some ideas around research. We also identified data sharing as another big issue. And so that's we identified that there's some really innovative strategies coming through in the homeless sector for data as they relate to data sharing. But data sharing has also been a really big challenge from the research community, where folks, for instance, who are clients of Calgary Fetal Alcohol Network will be really involved in research, but the research isn't shared with the community in any meaningful way. So they'll put a lot of effort into participating, but they don't really hear about how the research is mobilized. So I think those would be our 2 key take-homes.
Fantastic. And I'm so glad we're recording this because there's so much great information in there. It sounds like you guys had a wonderful discussion. So I've written down access to and treatment within acute care and data sharing with community. Mm-hmm. Okay, great. Let's see who's next in the little Zoom boxes. Stephen Richardson, if you're able to start your video here. Great.
Yeah, so Yes, similar. I think similar to everyone, we had a diverse group and a fantastic discussion. I'm not sure if my facilitation moved the group along as fast as we were hoping, but the two big issues that our group discussed was housing, particularly access to affordable housing, which I think falls under the more of a specific social issue faced by families. And then related to that was also restrictive funding. And restrictive funding operates at basically all levels. So whether this is how individuals are able to utilize, their family income tax credit, or Alberta Works, or how funded agencies are able or are providing funding to supportive housing programs, and the restrictive nature of that, and then all the way up to the federal government and how what types of housing models they're creating and the types of funding they're providing to try to allow individuals and families to get out of these structurally vulnerable situations. So lots of information, and I'm sure if there's anyone in my group that would like to fill in any of the missing conversations or discussions, please do.
Fantastic. Thanks so much, Stephen. And moving on to our next facilitator, I see Dan. Do you have a baby with you right now? Oh, amazing.
A little baby. But I can go here if that's okay. So some of we had a lot of discussion around data, which was fantastic. So I think the real common theme that came out of all of our data discussion was, how do we get data into the hands of the frontline workers? How do we move it from, as Jeffrey said, from the ivory tower into people's hands so they can use it in their day-to-day practice to help those to help the vulnerable populations. So that was a common theme that we discussed a lot. And we talked about the lag of data, so often when we go to access data, whether that's local or at a business or nationally, there seems to be this lag time for us to be able to access the data. And that can really impact the way we interact with vulnerable populations and the way our staff can assess their current situations and interventions that they're implementing. We discussed about ownership of data, like how the government really likes to hang on to data, which makes having an evidence-based approach really difficult for people who are practicing. And actually another interesting thing that came up was system level issues on data as well. So a lot of these smaller organizations and nonprofit organizations don't really have the capacity to store data safely, or they don't have the the computer infrastructure to collect it in the first place. So they might be putting it on notepads or putting it in Excel sheets, and it's not readily accessible to analyze to help their programs. We had a lot of other data conversations as well, but I think the other common theme that we talked about was upstream strategies and how that's not been a priority to date, and that a lot of prevention takes a long time to see results. And that the funding guidelines right now aren't really geared towards funding upstream strategies because of how expensive they are. So I think that they were the two main themes that came across, and they were really interrelated to the other topics as well, in terms of other things we talked about: natural supports, funding, and poverty, and government level issues. But a lot of them kind of tied back to those two main themes.
Fantastic. Sounds like there was quite a bit of discussion about data in multiple groups. So I've added, combined it with the point that Megan brought up, data sharing with community, going from researchers to frontline service staff, right. As well as building capacity in data systems in community organizations, and then funding upstream strategies.
Yes, great.
Great. And I love seeing parenting in the workplace. It's awesome, and I wish it.
2-month-old. This is beta.
Hi there. I love it. Great. Okay. So our last facilitator is Alexander. Alexander, would you mind turning on your video?
Hi. So our group had a lot of great discussion, but a lot of things I will do my best to just kind of summarize. So one of the big issues we talked about could probably be split up, but I'm going to kind of group it together, is the idea of resources and funding. So I guess on one hand, wanting to fund impact rather than specific programs, and kind of around that was the discussion of how do we persuade these decision makers and funders to fund impact that is truly important rather than just whatever fits within their kind of framework, I guess. And just kind of creating cohesion and collaborating with other community partners to be able to produce impact together so that organizations and programs aren't so separated. And then I guess similar to that is kind of the idea of utilizing our resources to be able to support grassroots communities, to know how to provide the right care at the right time when individuals present. And then I think to kind of echo what some other groups were talking about is the idea of information sharing and continuity across organizations so that you're not, so that we're able to kind of utilize the resources that we have without any kind of duplication, I guess, in a sense, minimizing fragmentation, and just, again, building those community partnerships to be able to provide sustainable long-term support. And then another big issue that we had talked about is just the idea of connecting with marginalized populations. So one of our members talked about how we don't know what we don't know, and that there's still some populations out there that we just don't exactly know how we can support in the best way possible because we just haven't had all the opportunities to meet with those individuals, or they're not kind of, they're just not presenting to us. And so being able to break down barriers to connection, form partnerships, and empower and educate our communities to be able to provide the appropriate resources to all these community members, friends, and loved ones. And, you know, within that idea of connecting to marginalized populations, we discussed specifically Indigenous populations, and how we can just ensure that we're building the best connections that we can and ensuring that we can provide support to, sorry, I'm not doing, I'm trying to sum up all their great points.
You're doing great.
But just maintaining engagement with our Indigenous populations. And yeah, that was, I mean, we discussed a lot more, but those are some of the big ones.
Thanks so much, Alexander. So sounds like you guys talked about breaking down those silos, communication and coordination between groups, so similar to what Megan Edwards brought up. And then I've listed also impact-focused funding programs and collaborations, as well as engaging and empowering marginalized populations, by which we mean really connecting directly with folks and building those long-term sustainable partnerships that we all talk about. And I think everybody could always use some work on. Okay, so we do have a few extra minutes though before we go to the poll. Is there anybody from the rest of the group who felt like maybe something was missing from the conversation here? Now's an opportunity to take yourself off mute and voice what you think might be missing from this conversation. Okay, sounds like our facilitators did a great job. Go ahead, Katrina.
Yeah, I'll just reiterate, I put it in the chat, but I know we only had time to sort of highlight the two big issues, but we will be collecting the notes from the facilitators. So we'll have the sort of more comprehensive, fulsome context of your conversation, and we'll include, we'll scan that and see if there's anything else that we need to add. And we will use those notes in our report that we will send back to you. So not to say you have to land on 2 and 2 only, that we will take a look at the full conversations. Natasha's going to create a bit of a poll. And again, this is just based on the big issues that you highlighted. And we're going to ask you to sort of rank and prioritize. Again, not to say that we're going to pick one thing that came to the top of the list and forget everything else, but it will give us an opportunity to see if something emerges as really important over some other things that we can put some good energy behind immediately. And then it also gives us an opportunity to look at how we can leverage other resources, other work that's already happening, and figure out a role in sort of all of these social issues. But it gives us a bit of a starting point for what we might do in the short term, while keeping all of these issues in the forefront and in our minds. So just to set that context as we move to this quick poll to just get some final thoughts and feedback from all of you.
Thanks, Katrina. And so I've got the poll ready here. So you'll see 10 options, and we ask that you could choose up to 3 of those options that you see as kind of the highest priorities. As Katrina mentioned, we're not picking and choosing here. We're just taking a look at where the energy is and where you would prioritize. So I'm going to launch that poll now, and then we'll give everybody a minute to choose up to 3 options there. So we've got about 70% of responses. Feel free to take your time. We'll do another minute here. Okay, just another 10 seconds or so. So if you're just finishing up your answer. Okay, great. So we're gonna pull that to a close. I know, Anne, it's really challenging to choose a top 3. So we'll end that poll, and I can share this with you guys. Can everybody see the poll results?
Mm-hmm.
So you can see there was definitely some coalescing around funding upstream strategies, data sharing with communities, so getting data out to frontline workers. And I think that goes both ways too. Those were the 2 that kind of pop out more, but there's also translating evidence into policy. 44% of respondents voted for that. So we can see some prioritization areas coming out of that. That doesn't mean that these other areas aren't important as well. As I think you can see, there's pretty split support across each of those 10.
I think too, what some of this might speak to, like things like breaking down silos and the housing, these are obviously really important issues, but these responses could actually speak to the fact that there's some really good work happening in the community in these areas. So, you know, I did mention there are agencies involved in collaborations already in various sectors that are working really hard around coordination and communication. And same with housing. There's some great momentum happening right now at all levels of government, actually. Well, maybe not all levels, but municipally and federally, with the National Housing Strategy and resources being allocated, and our CHAC group here in the city actively engaged in housing and policy work. So again, it may speak to the fact that there's some good work happening in some other areas, which is
fantastic. Yeah,
mm-hmm.
Absolutely.
Mm-hmm.
Okay, I'll hand things over to Katrina. Thanks so much for participating in this. If it were normal times, of course, we'd bring everyone together for a full day in a room and have lovely discussions around a table and have some food and coffee. So it's really fantastic to see people sticking around to engage in what is now, I think, a 6-hour Zoom call. It's, I think, a little unprecedented, actually.
Yeah, and honestly, huge thanks to all of you. This is something that has never happened to me in a situation like this. We are actually ahead of schedule. We are a solid 5 to 10 minutes ahead of schedule, and we did a lot today. So thank you so much for your great participation, your thoughtful ideas, your openness to engage in these conversations with us, your patience as we dealt with technology and speaking like robots in 2-dimensional formats, which isn't my preferred way of doing this kind of discussion, but is what the reality that we're faced with right now. So a huge thank you to all of you for sticking with us and bringing your ideas forward. We will follow up with a report back to everyone who registered in the event. We do have an evaluation form for session, which we would hope that if you have a moment, you would please fill out that evaluation form while this is fresh in your mind. Again, there's so much valuable information for us in terms of how we work this through in the future. Huge thank you to Natasha. Great facilitation today, great technical guidance and expertise. Also to Liz, who was instrumental in supporting us to engage Elder Croshoe this morning, and the technology issues as well. And of course to O'Brien Institute, who, if you haven't attended events from O'Brien before, they always do an amazing job, and they're very well organized and have great skills and expertise. And generally speaking to the O'Brien Institute, if you know me, and many of you in community do know me, you know that this work is really important to me, and I'm very passionate about it. And to have the support from the O'Brien to see this as truly valued work and willing to put some energy and some resources behind it is just amazing and very gratifying. So thank you again, all. I look forward to hearing from you in the future. When we send out our community report, we will include a link to that survey just to ask you if you have an interest in staying connected with us moving forward and how you would like that relationship to look. So I guess we'll stop there. Sincere thanks to our facilitators as well. And I look forward to hearing more from you in the future. Thank you again for a great day, everyone.